Great. Move that. Right. I'm just going to introduce myself. I'm Councillor Pippa Connor and I chair the Adults and Health Scrutiny Committee. We're just going to go around and do some introductions before we start. So I'll start with Dominic and then we'll go around to fellow councillors.
Dominic O'Brien, Scrutiny Officer.
Hi, I'm Sean O'Donovan, Councillor for Tottenham Hale.
Kathy Brennan, Councillor for Muswell Hill.
Lisa Polko, Councillor for Tottenham Central Ward.
Helena Carnier, Co-optee.
Thank you. Mark Held, Deputy DAS, working to Joe Party. Thanks.
Rachel Boston, Finance.
Richmond Kessie, Commissioner and Quality Assurance Officer.
Sarah Sutton, Corporate Director for Adults, Housing and Health.
Lucia the Nerves, the Cabinet Member for Health, Social Care and Wellbeing.
Jo Beatty, DAS for Haringey.
Great, thank you everyone. So I'm just going to go through some areas that we just need to quickly go through. We've got filming at meetings. Just to note that anyone in this room will be filmed and recorded for future broadcasts. So just to give you some warning on that. And if you're online, if you obviously come in for a question or speak, obviously that'll be taken up as part of the recording. Just checking there isn't anyone online, councillors wise, or anybody that we specifically need to introduce. Great. Okay, thank you. So welcome to everybody who is online this evening. Any apologies for absence?
Apologies from Councillor Ian Curran for lateness. Should be here a bit later on.
Any declarations of interest for these items? Okay, right. Deputations, petitions, presentations or questions?
No, none received.
Okay, we've got the minutes on pages 1 to 16. So I'd just like to draw the committee's attention to our minutes. So the minutes are taken up on, there's some actions from the minutes and these are on the tracker. So if you have received the tracker that has literally just come out, there will be some copies coming around, hopefully, from Dominic, or he can highlight where these should be found for you. So the actions from the minutes are on the tracker. These were given late, so these haven't got an update yet. So we have got actions that have been completed from our previous meetings below. There are some here that's still uncompleted. So we will just go through this in fine detail and make sure that everything is up to date. And apologies because I've literally just received the tracker. So I've just got it in my hands. So I can only apologise and say that this will now be circulated to everybody and the actions from the minutes will be taken up. Okay, anything else from the minutes? So accuracy, oh, sorry, Councillor Poku.
Yes, so it's just page 1 of the minutes under the question of interest. Under my item, it should be NWL and not NCL. Yeah. Thank you.
Okay, so I just wanted to move us on then under the right. Move us on to the next part, which was it was going to be agenda item 7, which was safeguarding. It was group-based child sexual abuse. And this was to receive an analysis report from the Metropolitan Police North Area BCU and scrutinise crime data to understand group-based child sexual abuse offending in Haringey. This follows recent discussions on safeguarding at 2 recent scrutiny panels. So, right. So I just would like to update the committee to say that we received an email from the police on Friday afternoon saying that they were going to be unable to attend. So it is quite short notice. So I have emailed back saying that obviously as the chair, I'm deeply disappointed that we weren't notified and that they weren't coming. So I think the bit that I was particularly frustrated by is that we were asking this as a question around the data, because from the data we've understood from our previous safeguarding meeting that when we were given the report, we were told that there was no evidence around grooming gangs active in Haringey. And then when we pressed further, we were basically said it's because they didn't have data. So we as a committee thought, well, okay, let's look and see what we can do, and let's see if we can pull out the data, and let's see if we can find out what's going on. So it was my expectation that the police would be attending tonight because they're critical, obviously, in that recording of the data and understanding of any group-based crimes and how they're recorded. So without this information, it's very hard to ask the council to provide services specifically for those young people who are suffering this horrific abuse. So, I mean, I had hoped we would have the police, but we haven't. So I've been in contact with the chair of Obion Scrutiny, Councillor White, and he has agreed that if possible, we can take this agenda item to the OSC meeting in March so that it's not lost. So we can keep it on the agenda, and that would be sensible because it does stretch across children's, what's the other one? The Culture and Communities and Culture Committee, Community Safety and Environment Committee, as well as ours as adults and health, because obviously we look at young people within violence, women and girls. So officers now being very supportive and trying to ensure that this agenda item does take place, but obviously it won't now be in our committee because this is our final meeting of adults and health for this year. So it wouldn't come to us again. So just again, apologies because we were going to have this, and just to let you know where we're at. So I've got 2 hands that were raised, Helena and, oh, do you want to introduce yourself as councillor?
If I could just say, I mean, it's very nice to stick it in another committee, but we were the ones that had the information, the questions, etc. And it's not very satisfactory that we're not going to be the people there to actually question the police. So I'm just wondering whether there can even be a pre-meet or something. I think we should be involved, is what I'm saying.
So I'll take that on board and I'll put that forward as an ask. I mean, to be honest, I've literally just been trying to work out this afternoon how we take this forward. It is difficult because I knew this was our last meeting, so the next one would be June, so it's quite a delay. So I think Councillor White was quite proactive in sort of stepping up and saying, you know, absolutely, if we can do it, we'll take it to the March OSC meeting. I can't see why you couldn't be in the room for the OSC meeting. I can't see there would be any issue with that at all, but obviously I can't, you know, he's the chair, so I'd have to run it past him first, but I'll have a conversation. Councillor McBouley.
Thanks, Councillor Connor. Good evening, everyone. I'm Councillor Makbule Guinness. I'm the chair of Culture, Community Safety and
community safety panel. So the reason I'm actually here is for that. And like you said, it's cross different committees. And I really wanted to be here to be able to hear what the police's update is. I could only say that it's deeply disappointing because I just had to rush from another meeting, like trying to get here on time and to find out that actually, well, that item wasn't going to be even here. But I think, yeah, maybe there is a way forward overview and scrutiny, but, and I agree with Helena that all the members and co-optees should be allowed to attend that meeting for that item as well. So I'm gonna probably shortly leave because you would know I don't have any business in this meeting, but I just wanted to be here for that item. Thank you.
Yeah, apologies that you've had a needless journey to the meeting this evening. We did put notifications out to people, but obviously I appreciate that not everybody's seen their emails and it's been quite short notice, so apologies for that. We did do our best to let people know. So sorry about that.
Thank you very much for coming. That is hugely appreciated. I know how precious time is for everyone. So as the chair of the other committee, we'll absolutely take on board what you said this evening and put that forward as part of discussion tonight. Thank you.
Thank you. Thanks, McBooley, for coming along. That's great. The just two things. Number one, sorry. Oh, sorry, I was not here to introduce myself. For those people who don't know me, my name is Councillor Mary Mason. I'm Councillor for Pounds Green. So first of all, thank you very much for following through on the no report of from the police, because I think I know that there is, and I'm sure all of you know that there are grooming gangs in Haringey. So the fact that their response was there aren't, and then had to be chased up to ask for details, and they said that they didn't measure that, is it's bad news. It's bad news. And I think that, so again, thank you to our chair and also for the chair of Scrutiny for following through and pushing it out. Number two is, can we please have the report in due time before that scrutiny meeting so that those people who can't come can read it and ask questions and pass those questions on to our chair so that they can be followed up and looked at before the meeting so that we get those answers, because otherwise everything is going to fall off the table. So let's put it back on the table, get the answers before the meeting and follow it through from there. Thanks.
Thank you, Councillor Mason. To be fair, the police did send through an email a very short while ago, but to be honest, it was quite extensive and it covered the whole of London. So I really haven't had time to unpick which bit is, and to be honest, it wasn't Haringey specific. So I think there is a lot of information about how they're recording it, but I think it needs to come to a scrutiny committee. And to be really clear, because it is, you know, that clarity needs to come from the police, not from me reading out an email.
Could I just jump back on that? Because this information is available. It's not that it's not available, it's in the public domain. So it just means being able to go to the correct sites and to track them down. And it's available for our borough. I could show them how to get it. I'm not going to, but it's really straightforward. And we have had this problem at police meetings where they've said they haven't got the material, but it's available. So I think we should push that and not accept that it's an all London issue. All you have to do is to highlight what crime you're looking at and highlight which borough you're looking at, and it flashes up. Thank you.
Thank you, Councillor Mason. I will also take that into consideration. Thank you very much. Councillor O'Donovan.
Thanks for that. And I think it does fall into definition and exactly how the police are recording these crimes and how they've recorded them in the past. I know, and I think that's one of the reasons you got London-wide data is that the Metropolitan Police are looking into 9,000 historic cases that might fall under the broad criteria of group-based abuse. And I think Sir Mark Rowley was speaking about it, I think in November, and at that point there were the 9,000 which they're looking into. I think they had looked into 2,000. So I think what we need to do is find out how many of those 9,000 they're looking into originate in Haringey. In terms of why it's the board-based criteria, is that because there is grooming gangs, usually with a capital G and 2 capital Gs, which relates to the particular form of abuse, very serious abuse that was taking part in the north of England. That may be happening here, but I think they're also looking into child abuse within families, institutional abuse, peer abuse, and online abuse, which is no less serious than that. So I think hopefully you will be able to get information, possibly not from Haringey Police and Enfield Police, but from the Metropolitan Police, because it is an ongoing. I know that they are looking into these 9,000, and I think it's probably up to organisations like this, working with community organisations, to talk about how we want those and child protection, safeguarding professionals to choose what categories we want these crimes to be recorded under.
Okay, thank you very much. And again, that's really helpful to have your input this evening. To be fair, I mean, I did get that email was talking about the 9,000, but I only had a quick moment to skim read it and then sort of think, right, okay. And we do need, as I think we've all said tonight, we do need the police in the room to have that scrutiny conversation with them. But we'll definitely have. Share that email. Yeah. Yes. Yes, I can. Okay. Yes. All scrutiny is open and transparent, so anything that comes to me. So just to let you know that we will be putting together the criteria for the next meeting, and all the thoughts you've put forward this evening and your own recommendations on it will be taken forward as part of that. So, but thank you very much. And again, as I said, yeah, we're just going to take this to open scrutiny.
Could I just ask for one more question, which is, can we ask Child House, which is the therapeutic service response for the whole of North London, for their statistics for child sexual abuse in Haringey, because they collect those statistics. They should be available to our children's services. They should be readily available because we're making the referrals in, and they do produce statistics, so it would give us a really good idea of what was going on in Haringey to get those, because professionals are all referring their children there for support. So I think it would add to the discussion about what's happening.
Yep, that's fine. Thank you. Okay, any other inputs at this moment? Okay, thanks. Welcome, Councillor Haran, to the meeting. Okay, so I'm actually going to slightly alter the agenda now. In fact, it was on item 3, items for urgent business, but I knew people were coming into the meeting for the police report, and I knew that we needed to let people know what was happening with that. So we're going to go to the items of urgent business. There should be an email around. Let me just check this. Yeah, thank you. Sorry, I had so many updates this evening. Great, thank you, Dominic. We went to the Joint Partnership Board as part of our scrutiny around communications with the council, with residents, and as part of our Joint Partnership Board questions and answer session, what actually came out were some quite significant concerns around safeguarding. Actually, the responses to concerns they've made, or phone calls that people were putting through. So this is very rare, but I think there were so many significant concerns raised at that meeting. We decided then to take it forward as a matter of urgent business for this committee tonight. So there's basically an email that's gone around to all the officers here tonight, and we've put it down as some bullet points. The information that we had from people at the Joint Partnership Board was that there were real concerns that people weren't answering the safeguarding phones. So if a call was put through, no information was provided as to when they'd hear back regarding their concerns. If they filled out the safeguarding form, there was no recognition from the service that this had been received. There were long waits to hear if the referral had been accepted. There was no way of finding out who to contact if they didn't hear anything once the form had been submitted. No reference number they could use in a follow-up email to track what was happening. And when contact from the council was made, no time frame for when any next steps would happen. So tonight, it's great to have the officers in the room. And I think we were particularly keen not only to understand about the operational aspect of this, but I think really to understand if and when these practical areas can be addressed. Because obviously, you know, these are coming from people that are very used to trying to get hold of the council and their Joint Partnership Board. They're very used to sort of having all those communications, and there was organisations on the call as well, and they again had many years experience of trying to get through to the council and that whole thing of communication, and everyone was pretty much saying the same thing around. And I think it's the practicalities around the phone calls being answered, references being given so they can easily track what's happening and basically know where, you know, phone numbers or how you contact if you don't hear back, and then a time frame for understanding when what you've put through will be responded to. So I'm going to hand over to, I'm either looking at Sarah or Joe or Councillor Desneves. Indeed, so thank you.
Thanks, Chair. I'm going to go first very briefly, and then sorry, my voice is still haven't recovered from the bug. I'm going to go very briefly, and then I'll hand over to Joe and the team. And the first thing to say is really to thank you and the committee, because actually in doing this piece of work, difficult as it is to read, I suppose, it's also very validating, because the things that you've identified are indeed the things that we've identified for the improvement plan. And I don't want to go on about that. We talked at length, I think, at the last meeting about the improvement plan and about the issues and the things that we see that we need to do better on. And I think you know that we're very aware and very conscious of that. And we've set out our 3-year plan and our first year. And it is validating to understand and to see that in your questions are some of those elements, those things that we've identified that we need to do better on. So I just wanted to acknowledge that and thank you all, but really also say, as you know, we don't take these matters lightly, and we're very much on a journey that we think will take 3 years with some priorities. And there's some actions that we've taken in recent times that I think the team will talk about that are the beginnings of that work to make sure that we serve people better, which is, after all, what we're all here for. So thank you. And Joe, I'm handing to you.
Councillor Connor, I thought I would maybe do a bit of an introduction and answer them all in one bulk, and then you members will have lots of other questions, I'm sure. So we'll talk about the here and now to start with. So currently, safeguarding referrals into adult social care received through our front door arrangements. And the intention with having front door arrangements, as you know, is to provide a single consistent route into the service. So there's no separate or direct safeguarding telephone line. And when you ring that number, option 9 takes you directly through to the team. And that is focused on consistently triaging, appropriately risk screening, and having a clear recording and audit. And just to be clear, referrals, as you know, can be made by the telephone, as I've just said, the online safeguarding form, which we'll come back to, And also we get many referrals from written correspondence from partner agencies, including the police and health as well. We recognise that some callers may experience difficulty getting through by telephone at peak times. Where this occurs, calls are queued or directed through callback arrangements. And if callers are calling from a mobile phone, they're sent additional information about how to access information on our website. I think the crucial thing around our existing, the way in which we initially respond, is that demand is a big issue for us. And hence this is a real cornerstone of our improvement plan. And a cornerstone of the work of the independent safeguarding review that we've commissioned, both to look at the role and functions of our safeguarding board and the way we perform our statutory duties, not just in social care, but across the wider partnership, and more specifically to improve. We are still, as we've discussed previously here at Scrutiny, quite an old-fashioned and traditional service, and hence our digital roadmap is a critical piece in our improvement journey as well. I think it's important to say that safeguarding referrals submitted via the online form are received centrally again and triaged by our safeguarding duty function. And whilst referrals are screened and progressed internally, we accept that externally the visibility of how that's being progressed is not always understood, and there are improvements that we can make there, another key strand of our improvement journey. But work will be carried out behind the scenes, and is, to ensure that protective measures are in place and dependent on the risks identified during the screening. I think we've covered some of this before, but I think it's quite important just to cover it again. So safeguarding referrals are professionally screened to determine risk, level of risk, whether the concern meets the Section 42 thresholds, whether immediate protective action is required, and the most appropriate pathway. And I think it's important as well just to understand that safeguarding is mostly really complex. And undertaking investigation could take different amounts of time dependent on that complexity. I think the last piece that I would mention, just by way of introduction, is the work that we have in hand. And forgive me if we've repeated some of this before, but the safeguarding review, as I've just said, we've appointed a strategic programme lead for transition, for safeguarding, because we have a transitional phase now. Whilst we get the recommendations from the safeguarding review, we just need to hold this piece safely. And once we have the recommendations through our internal governance, then we'll be able to forge ahead. It may well be that we do some restructuring to ensure that making safeguarding personal is a golden thread piece across the whole service. Mark's appointment is absolutely critical. He has extensive experience in this space, but he will also lead on performance across the service, including in safeguarding. We've also got a new Safeguarding Adults Board Chair, Natalie, that you've met, who started around the same time as me, April time last year. And we've got an excellent new principal social worker, Richard Stevenson, who starts with us in mid-March. And his role will be around the practice at the front line and really gripping the practice at the front line and looking at the detail of what happens there, ensuring we've got consistency so that whoever the resident or the stakeholder or the member is, that they get the same standard of service from adult social care in this critical piece of our work. I know that you've been involved in discussions with digital, and that Dom attended one of the sessions we had with our digital colleagues present. We're really making progress there, and that is going to be hugely helpful to us in managing demand in this area and in ensuring that we get to the most critical cases, the most important cases at the earliest opportunity, and that anyone else is signposted to the right support for them depending on what their issues are. I think we have more work to do, though we've done a huge amount with providers as well. And as you know, we meet monthly with Richmond and the team, with our providers, to talk about how we can better respond to their safeguarding inquiries. And the critical piece for us, and in many ways most exciting to me, is reinforcing the role of the front door for adult social care, and the transformation of the front door that is well underway now, and will be progressed. Within the next month, we'll have a load of HR pieces to pursue in that space to be compliant, but that will make a huge difference, I think, to how responsive we are, how person-centred we are, and to some of the issues that the Joint Partnership Board identified. I'll stop there. Thank you.
So Sora, did you want to come in before Helen asked a question? Yeah, okay.
Thanks. I just wanted to add to a couple of things. I think we've referenced them at panel before, but it would be helpful to highlight, we are absolutely working, as Councillor Dasnev and Joe has said, on our improvement plan, but we've recognised that staffing and capacity levels, and we spoke about the demand when we had the SAB board report, which I think was at the last scrutiny actually, and therefore the importance of increasing capacity. So what will go along with the budget proposals for the next year's budget is an increase in staffing in the base budget to increase staffing levels. So there's an additional 3.6 million investment in staffing proposed, subject to approval of the budget. And also worth referencing that actually some of the improvements are live already. I think we spoke at the communications review with the panel about the new adult social care directory that's on the website, still a work in progress, but is much improved by way of the data and up-to-date data for signposting. And then the other thing that has now happened is the connected communities are now integrating into adult social care, and that transition has happened. So that will give additional capacity to the team, and there's also scope within that for those complex cases across housing and adults to be supported in a different way to maintain sort of early intervention and prevention, which we hope will kind of all of these set pieces combined alongside what Joe has said will help us meet the ever increasing demand challenges in this area. So it's not one single thing that will help us meet and respond to demand. It's the collection of those things as part of our ongoing improvement journey. Thanks.
So Mark, can I just hold you for a second? I've got Helena and Helena, Councillor Brennan and Councillor Mason, and then Mark, would you like to come back in at that point?
Thank you. I'm going to take the role of the poor person ringing in, and I do call them poor because that's what I do with my NHS work a lot. I'm really, really concerned that I don't think your timetable is good enough. It's certainly not good enough to find that people that say they're going to ring back don't ring back. The other thing that happens is that people can't find their way through the website. And anyway, most safeguarding issues should be spoken about and not a form filled in. Is this a 24-hour service or isn't it? If it isn't, it has to be absolutely upfront that you can't do it. I think if you can't do it, then you must manage those expectations and say you can't do it. Because what you've got are people hanging on the other end, not knowing what to do, because they think that the telephone number's going to be answered. It's not answered. They think they can use the website. They can't use the website. So I'm just saying it from the other point of view. You know what you're up to. They don't. So if I could just say that, please.
I'm going back to the meeting that we had with the DH, and so one of the things that came up was that this was someone who works frequently with Haringey, and she said every time she tries to get through on a normal or to ring up, every phone number that she rings has an out of office reply on saying fill in the form on the internet. So nobody answers their phone. So she said, I've given up. She said, I try not to contact the council. I've given up because all I get is nobody answering the phone and being told to fill out the form in online. And for me, on a safeguarding issue, I think that's totally unacceptable, because safeguarding is important. That means it's crucial. So I was wondering, it's an ask really, if we could actually do something about that particular thing. We can't have all the staff putting on the thing saying, go to the internet and fill in the form. And the other thing was that, in fact, she also said, or one person said, that they did find the emergency safeguarding number, but it was buried in a form on the website. So they only found it by reading, they persevered and read this form and found the emergency safeguarding number. So that's obviously not obvious to people. And so we must change that, because they must be able to actually get help, actually reach us. It sounds like they can't. Thank you.
Thank you. I mean, I can hear that it's overwhelming, that there's huge problems. The fact that we still haven't got the technology to deal with them, and you're sitting there having to deal with these immense problems is troubling. It's troubling for you and it's troubling for us. I regularly try to contact adult social care, and I regularly have difficulties with that because I work at the local food bank, taking in people from Wood Green and Bounds Green, and usually see about 10 people a week, of which 2 or 3 are usually people who need some kind of direct support. One of the things that I am very aware of and have been for a long time is the deficiency in relation to early intervention and prevention. Because surely if you know that somebody just needs a bit of help, then having a good early intervention response takes them off the, off the board, if you like, off that diving board where they will fall if they're not given that support. And support from your fellow citizens is hugely important. If you ask the 200 people who come to Bounds Green Food Bank every week, why do you queue up at 8 o'clock, 9 o'clock? We don't open till 1. Most of them will say, because we come so that we've got people to talk with. They will stand in the heat, in the rain, in the snow, because it gives them somewhere to go. And when you have people to talk with, it means that you have connection. And having connection means that people can give you some friendly support and advice. And also it means that when you have a real problem, then you will contact adult social care. But when you've got not a real problem, or I don't mean a real problem, but like something that is desperate, then you will go to adult social care. But you are now receiving all those people because we have not got sorted across the borough early intervention and prevention. And this isn't a blame game. This is just a begging, really. Please, can we set up ways in which people can go to support groups, people can have access to, don't have to be highly specialised people, but access to what used to be health visitors, community nurses, those people who actually acted as huge security and support for people in the community, which are not there anymore. So to me, looking at that factor and putting some resource into that would help us to look at how we can prevent all those people queuing up at your door day in, day out and causing overload. You must be overwhelmed, and I don't blame you for being overwhelmed if that's happening. But let's have a look at the problem as a bigger problem and then try and reduce what's happening so that you can get on with the work. Thank you.
So there's a lot in there. There's a lot in those questions, but I really do want to focus us particularly on the specific questions that the Joint Partnership Board brought to us, and we said we take as an urgent item of business. So again, sorry, Mark, I know you're waiting to answer. I will take your answer, and then I'll take Councillor Donovan's question and Councillor Opoku's question after that. Thanks.
Thank you, Chair. I suppose first and foremost, like my colleagues have said, I think it's incredibly valuable to have the feedback because it does triangulate and fit with some of the work I know across the organisation we've been doing to ensure that, yes, we have some challenges. There's no question about that. And I'm probably as sorry as anybody else around this table in terms of those challenges and how that impacts on someone's life when they're on the phone and they're worried and they're scared and what we want to do about it, because we clearly and absolutely want to reach those people. Sometimes systems fail, and that is a reality. That's what we're talking about today. But it's a reality that isn't just Haringey. It's, I would say, in every authority I've been in, safeguarding is overloaded, it's busy, and some people sadly get missed. But what's important to me is to ensure that where people have been missed, and it would be helpful, I know it's not for today, but to know those people that at the joint board raised those issues, to meet with them and hear what the problem was so that we can put it right. Not just, oh, it's an issue, but we want to hear that voice and understand those sorts of problems. But I'm new into Haringey. I'm relatively new. This is week 5. I've just started. Excuse my voice. I've got some infection, throat infection. But I think the important thing I'd like was, there were a couple of key things I need to say. One that relates to professional integrity of the service, and particularly when we look at safeguarding. Joe's already highlighted the complexity of that work. There is no straightforward process to deal with a safeguarding case. It is individual. It has complexities that we entrust with our professional line to ensure we deal with those problems effectively. From what I've seen in the last few weeks and the cases I've looked at, I would say that our integrity is sound, that our professional judgment call on cases is effective. And in a sense, a council is entrusted that responsibility to professionals to ensure that they work effectively for us. And it isn't just them. And whilst we're here at Scrutiny, they individually are scrutinising themselves under regulation. They're accountable for their practice. They're accountable for their behaviour, their values, all of those things. And when it comes to safeguarding, the lens is on them. And we have a great workforce. We have a workforce that has limitations because of the volume of demand on it. And we're already putting in place investments in terms of how we strengthen safeguarding, so we can not only deal with the inquiries that come in today, but what have already come in and we know we need to deal with. So we're fully conscious of that, and we fully understand that there are issues and there are systems issues, but we're here to put those right, and we're here to listen and understand that. So I just want to say that there isn't anything extraordinary or unusual, except for any individual who's been experiencing those challenges. I'm disappointed. Professionally, I'm disappointed that we didn't quite get that right, but we can put it right once we begin to change the system, but also understand those specific issues that we can't talk about today. But I certainly, for one, would want to know those specific issues so we can put them right as we go forward. And that's what this is all about.
Thank you.
Thanks,
so
Chair.
I've got hands coming up straight from my fellow colleagues. So I'm just going to sort of try and draw us back. I think in Scrutiny, we very often hear the reports and sort of the big picture and what the hope is. And whilst we completely understand that and take on board, I think today, when we went to the Joint Partnership Board, their ask was really clear. When we call up, we would like someone to answer. We would like someone to tell us how long that process is going to take for something to come. And if we don't hear back in whatever time frame it is, this is the number to call us back. And here's the reference number, so that, you know, I'm not speaking to Joe one day, Mary the next, Sam in 3 weeks' time, all of whom I have to say to the same story again, because nobody quite knows where my referral's gone to or what's going on. Once you have a reference number in, it is, you can just, hopefully there is a system and you put that in, and then whoever answers the phone or when they're chasing up can find it. I mean, there are some really simple, and I know I'm saying simple, and I'm sure it's incredibly complicated to do, but I think from a resident's perspective, it's that acknowledgement. They've been heard. They know what the time frame is. They've understood. And then when it doesn't happen, they know who to call. I mean, I hope I'm not being it just, it's almost in that sort of capacity. So I'm going to go straight back to, I can't remember, was it Councillor Donovan first and then Councillor Pokey?
Thanks. Yeah, in terms of what we heard last week at the Joint Partnership Board, people were talking about the journey. If they realise that somebody is in some difficulties, and obviously to get to that point, you know, to actually get to the point where we think we need to contact the council is something quite huge, and we want to make it, as I'm sure you do as well, want to make it as easy as possible once they've decided to report something. If you look on the Harringay Council's first menu page, which is the things people come to, somebody first said that, well, actually, if you look on there, you see there's stuff about parking, penalty charge notice, pay your council tax. I understand those boxes are there because that's probably how people first, or most people come to the council website because they want to complain about a parking charge or pay their council tax. So the first question is, should there be something there that talks about safeguarding? If there's an emergency problem, this is how you can contact it. That's one thing. The second thing is the council services are underneath, and actually the box for adult social services comes all the way down at number 14. Obviously, I think it's in this panel we'd like adult social care, sorry, actually adult social care it is, that we'd like that bumped up. Even if we had it in alphabetical order, it would be pretty near the top, but obviously we'd like children's, young people and families to be high up there as well. There's two routes into safeguarding. Once if people know the system and they know it's a safeguarding issue, they can Google, so they can put in the search bar safeguarding, or they can go through adult social care. Under adult social care, there's 3 items: care assessments, equipment, and caring for someone, which are incredibly important, but I think maybe there should be a 4th one for safeguarding. But if you just type adult social care, you get onto safeguarding, as people have said, and also if you just put in the search engine, you do. And on the first one is what to do if you think adults has been abused. I think this is incredible. Once people get to here, it's incredibly clear. It says, in an emergency, please 999. The second stage is you can email safeguardingadultduty@haringey.gov.uk. And I suppose my first question is, do we have statistics of how many people have emailed that every day, every week? What is the situation once that's emailed? I think Sarah or Lucy was saying it's triaged. What people really wanted was some sort of immediate, some safeguard themselves that it had been received, an immediate acknowledgement. You know, nothing else apart from we have received it and we are dealing with it. I mean, is there any reason why that can't be done immediately within minutes? The second thing is the initial reply, which I think we were talking about before, which is the time when maybe after triage, there's at least a reference number. So people know if they have to contact again, there's a reference number. And then the third thing is the response. And I think, again, Sarah was saying at the last meeting, she wouldn't call that stage a resolution. She'd call it a response. She'd call it our response, because a resolution is when the people who contact us decide it's resolved. So the other thing you can do on that page is to download the safeguarding alert form, which I think has been described as an online form, but it's not. I don't think it's an online form in how we normally think online forms now. We put the information in and we just send it off. This is actually a Word document, so people have to be able to, and I've not been able to do it on my iPad or my phone. They have to download it as a Word document, then fill it in, then save it, and then email it. I mean, is there any reason why that can't be an online form that you can just type in as it is? When you go to the online form, that's when you get the phone number, which I think is the adult social care phone number, which I think is understandable. It's the one that ends in 1400. Again, well, I suppose the first question is when people manage to fill in the Word document and post it off, what happens then? Do they get an acknowledgement? What is the process? Is it triaged by the same people? The second thing is the phone number. I think this may be the phone number that people are saying may have difficulty getting responses or maybe getting to the right person. I don't know whether that's true or not. Maybe we know how many into that 1400 number, how many safeguard cases go into there. And I think again, because we should phrase things when they work right, it is very clear actually when you go on to another part of the website, it's very clear that 1400 number is in-office number. However, if you're reporting safeguarding issues or harm to an adult or child, it is a 24-hour, 7-day-a-week number, which I think it's very clear on that part of the website. So I suppose it's common to lots of problems that we have, making sure the website is easy to access. And I think if you know it's a safeguarded issue and you put safeguarded into the search engine you will get to the right information, but it's making sure that it's readily available. And I suppose coming back to that thing about whether or not on the first page they could be, without worrying people, just say, if your matter relates to the safety of an adult or child, this is the number to ring. And I think the other thing that came up on the Joint Partnership Board is about people not being able to use websites, the importance of bits of paper and being able to use it. And one of the things that we suggested was using Harrogate People, because in Harrogate People, there's obviously all the articles about what differences, but there's things there every month. And one of the things is councillors' contact details, which would councillors may be important. I think also there should be a box on Harrogate People. But maybe if we pick 4 or 5 emergency things, if you have a, problem with your electricity, if you have a problem with your gas, there's a safeguarding issue, and that box should be in every Harrogate People. So people, even if they don't use it, even if it's not something that's happening now, it'd be something that they will keep and they will store, so people will have some idea of if there's a safeguarding issue, this is the number to contact.
Thank you.
Thanks.
Thank you very much. So that's fleshed out a lot of the bullet points that we initially brought up, and Councillor Opoku.
Thank you. Just going back to the meeting as well, I think, and also Joe, something that you said, because I think one of the complaints is that people are calling up and then they're on hold and they're told, if you want, hang up and then we'll call you back. They don't call back. So is there a problem with the callback system? Are we going to fix that callback system? Why, we need to address that issue. The other that paper mentioned as well, something that somebody said was a simple fix. When you fill out the form, you email it, you could get like an automated email back saying that we received it, and then this is the timeline, we've got it. We should call you within a week, 2 weeks, expect XYZ. Those are simple fixes that shouldn't take too long to just put on a form when somebody submits a form. There's another one that was quite concerning. I don't know which form they were referring to, but one of the forms times out. So, one of the members that was there was like up in early hours of the morning trying to complete this form on their phone because they didn't have access to computer. Each time it would time out. They didn't know how long they had before it timed out, but they knew that it was going to time out. So somebody who is in distress, has these kind of difficulties, is there a way to not put a time limit or to have it so that you can save the form and then come back to it another time? This time you couldn't save it. So each time they had to go back and complete a new form again and hope that they've managed to get it in on time, before it times out. So those are some of the things that they mentioned. The other one was, which I think Councillor Donovan has said contradicts. It's a bit different what they said, but they were saying that the website isn't working. I think they said that whatever they're going to look at wasn't functioning well, but I've not had a look at the website it's myself, so I can't comment on what they were saying, but I think was some issues with that. But yeah, I think it was quite a useful session to have and just to hear just experience. And then also just our partners that we work with too, one of their comments was, is there a way that, because there's like a lot of joint working, can they have some kind of special contact that they can also email themselves or call so that they can also expedite some of their cases that they deal with, because they don't have any of those types of things, and also just updating them, because I think when Marcus Garvey, the one-stop shop was closed, they weren't aware of that, so they were referring people to Marcus Garvey Library, not knowing that it's closed. So just working a bit more closer with them, sending out those kind of comms to them to let them know those types of things. Yeah.
Okay, so in the response, I'm looking for somebody to say to me, us, oh, right, we can do these practical, I mean, it's like the nuts and bolts here, I think we're looking for. So, yeah, Councillor Stebbs.
I'll just come in really briefly, Chair. I think it's really important to say that those nuts and bolts are things that are in the improvement plan. So those things are those practical, because you're right, there's no point talking broadly about aspirations. So I just think it's important to emphasise that. I'd say to the team here and to you as well, it's really disappointing to hear that partners don't feel they can come to us, because they do all have escalation routes, and they do have, many of our partners have direct lines to me and to all the people who are in this room. So it's disappointing to feel that, because I certainly know the partners you've mentioned haven't written to me ever specifically or spoken directly to me, and I also meet regularly and are in spaces with those partners regularly. So it's really disappointing to hear that, and I think there's something, of course, that we can do about that for sure, to emphasise that, and it might also be that within those organisations not everybody has that same information or is sharing it. I think the team will come in on some of those specifics. But there was a point earlier about like wanting to come in on prevention. I think all the time I've been a councillor, those who've been around or been the cabinet member for sure, those who've been around a while know that I've always been really passionate about prevention, and it's always been really difficult given the circumstances to make that case. But we're winning that case, we're winning it nationally, and we certainly have more prospects of being able to implement, and Sarah can speak to the service that we have now that speaks to that, but also our work on neighbourhood health with the NHS also speaks to that. And there was no one who was more joyful than me when SIPFA, the finance organisation for local government, came out and said, yes, prevention does work, because many of us have been trying to argue for that for a long time. So having that creates the environment in which we can do that, notwithstanding there are difficulties in, still funding those things, as you know. But I think it's just, I really want to emphasise those practical things are in that plan. And that's why it's reassuring, as everyone said, to hear that we are planning for the right things. Some of them are quicker fixes than others. And it feels like quite a lot of the conversation as well is around how we manage the website. And I think there might need to be a session with councillors more broadly around, because there's a lot of evidence, because I've questioned the same, for example, how people access. I know digital is not for everyone, but those who do actually access digital, my understanding is the most common thing to do is to do exactly what Sean said, which is put safeguarding and Haringey into Google. And the most important thing is that that's your top find. That doesn't mean that people don't access through different routes, but those will have all the data. We know exactly, comms know exactly where people come in, where they come in from, what they've put into Google. That's all accessible. So some of what you see in that front page might well be determined by that. Those things are there because that's the route in which people are coming, not exclusively. But over to Jo and Zara.
Okay. So I would mirror what Councillor Dasnevs has said. I think we have got issues around capacity, workforce development, digital response, information advice and guidance in hand. The bits that I just wanted to reflect back to you, the practical bits, Councillor Connor. We've got a very strong relationship with the Joint Partnership Board. As you know, we invested in them this year. We recruited a new chair, a fantastic Natasha Ben, and we are working really closely. I sit on the JPB, and going forward, as you will also know, we'll have 2 officers from social care will sit on each of the reference groups. some yet to be developed, learning disability and mental health, the rest well and truly established. So I think those routes of escalation that Helena was speaking about, you know, people-based responses, speaking to residents, you know, with lived experience of learning disability, mental health, dementia, and the interface with safeguarding will grow from the grassroots up. I think short term, what we can do, and this is Mark and I, is we can revisit the transition arrangements we've got in place now while we're getting the safeguarding review outcomes, because the points you've raised, some of them are practical, and I think we can just have another look at them after today. I'll be with the JPB again on Thursday, and would like to give them some feedback from tonight myself, just to say we've heard, and you know, let's think about how we take them forward practically whilst we're implementing the review recommendations. But all really helpful. I think it's about pace, and you know, we're working as fast and very, very hard as we can, but fully recognise everything that you've said tonight is about people's here and now. They need things here and now, so we'll do our very best to see what we can do short term as by way of that transition.
Okay, so I'm very reassured to hear that as part of this process that you are going to look at the practicalities in that transitional period. I think for me, and I think Councillor Donovan's done quite a deep dive and given you quite a thorough overview of some areas. Helena, who's also got quite some comments on just the reality of when you can't get through and you're stressed, and how we make that better, and how we do that, if possible, as quickly as possible in those fixes in that transition time. I think the Joint Partnership Board will be really pleased that you are going back and having those conversations with them. I think this wasn't them, you just hear this was actually part of another, we were doing communications as a whole, but this just stepped out to us. And because it was the areas of concern were so significant, we thought actually very unusually we would be bringing it here tonight from urgent business, just because if you can't get through at that point, then that's really difficult. And whatever we can possibly do to support you and support that process is really good. So I'm really pleased, and I look forward to hearing what those outcomes will be. And I'm sure that will be going through the Joint Partnership Board as well. So I can ask the chair as well how that's going. But if we could obviously have sight of what you're doing from this committee, that would be good. So I think we've captured all the points from the Joint Partnership Board. I'm just checking there's no one online. Before we move on from this agenda, Joe, also I've got some safeguarding follow-up emails with yourself, and I just wanted to make sure that those were in trail, because that's part of the feedback to the committee on the tracker. So I've got some of that information, but I'm just waiting for that next step so we could put that through, so that the committee have the safeguarding responses back from our previous meeting. So that just reminded me. So thank you very much, and thank you panel for being at the Joint Partnership Board and bringing back this very important area to the committee this evening. So we are now moving on. We are going to the Quality Assurance CQC overview. So we've got members, I think we've got someone on from the CQC tonight. So I'll ask Dominic in a moment to introduce them. And also we've got our own council report as well. So Dominic, who have we got online tonight? Sorry.
Yeah, so Richmond Kessie's here from the council, from the quality assurance team, and then there's also Andreas and Mohammed from CQC who are joining us online tonight.
Okay, so we have a supplementary, this is a part of the supplementary pack, so it's agenda item 8, is on page 1 of the supplementary. Richmond, I've got you in the room, so would you like to just give us a sort of a brief overview of what your report entails, and then we'll ask for our colleagues online to come in and give us their report from the CQC perspective. Thanks.
Good evening, Chair, and thank you for the opportunity to present this year's overview of quality assurance activities across Haringey adult social care provider market. The report outlines the work undertaken to safeguard quality, support improvement, and ensure our residents receive safe and person-centered care. The past year has continued to be challenging for care providers with inflation and rising workforce costs, placing pressure on service sustainability. Through our annual inflation uplift, we have mitigated these pressures as far as possible and ensured a fair and equitable distribution of available funding. While this cannot fully overcome national funding constraint, it has helped maintain stability and continuity of provision. However, despite these challenges, we've strengthened our engagement with the market. Our monthly provider forums remain well attended and provide an important space for shared learning, early identification of risk, and open dialogue between council and the sector. These relationships support our wider aim of fostering a resilient, high-quality market that can meet the diverse needs of Haringey residents. This report highlights several key themes. Over the period, the Council Commission cared from more than 220 CQC registered providers, both in borough and out of borough, and supported over 5,300 residents. We've seen market shifts, including an increase in out-of-borough placements and a rise in unrated providers locally, Our policy of avoiding new placements with unrated services remain firmly in place and to ensure residents are placed only with providers that meet expected standards. The quality assurance team continues to play a critical role in identifying and supporting providers requiring intervention. This includes those with declining CQC ratings, safeguarding concerns, or operational risks. Through improvement plans, welfare checks, and joint working with CQC, the ICB, or the Integrated Care Board, and host authorities, we have supported several providers to make measurable improvements and prepare for CQC reinspection. We have also embedded the quality assurance and contract management framework across adult social care. This framework has strengthened governance, risk oversight, and coordination between commissioning, safeguarding, and contract management functions, ensuring early intervention and consistent practices. I welcome the panel's reflection on the work, and I'm open to take any questions. Thank you.
So do we want to have the CQC's report as well on, because I think actually that might cover some areas as well. So apologies, but online I've got Mohammed and Andreas. They've got a quick slide deck to show us. You have got a few minutes to present. So if you could just speak to any areas you specifically want to pull out rather than just, obviously, we will have read the slides. So you also don't need to read them all out. Just pick out areas. Thank you.
Good evening. Thank you for inviting us. So we prepared a slide deck to kind of like look an overview at Haringey, sorry. I think what's interesting to see in what we have to acknowledge is that Haringey actually overall, in regards of rating, services are better rated than they are over London and nationally, which is very, very positive to see. I think one thing which is probably of most of interest for all of you is we are obviously aware as the regulator that we haven't done in the past what we have promised to do due to lots of internal issues, which you're probably all aware of. So for us to target to tackling these issues, we have committed to carry out 9,000 assessments nationally. We also have committed to recruit more registration inspectors to be much quicker in regards of our registrations. And we have set new priorities, which have started already in January in how we assess services. So obviously we still have to respond quickly to urgent emerging risk, which is always our top priority and will always be our top priority. But we also look at services, obviously, which have never been assessed, which obviously Richmond just like mentioned earlier on. So we are aware of the fact that there are a number of services out there which haven't been assessed whatsoever, so they have no rating. And then we're looking at services which are rated or flagged as very high risk services. So they're generally larger providers or providers where they have been any ratings of requires improvement or inadequate, or inadequate is not an issue with Haringey. And then obviously we're looking at services which have not been assessed or inspected over a year. And then the next thing is services which have older ratings. So there are a number of services out there. And I looked at the Haringey portfolio. There are quite a few services out there which have a rating which is over 5 years old. So obviously we are fully aware of tackling that. I think on our long-term plans for improvements is to redesign our entire regulatory process. We have and we continually carry on test and pilot our assessment approach, looking at new technology. So we're looking at the moment as how we could use AI to speed out the process, how we can reduce report formats, which speed up the process. We have improved our online portal, so providers can contact us much easier. And we, as I said earlier on, we continue to strengthen our registration process. So that's in short going to the slides which I have prepared, so you can look at them in greater detail in some of the information which is there. So thank you very much. Over to you.
Thank you very much. Okay, so I'm going to open this straight up to questions. I've got Councillor Brennan.
I've taken on board what you said about getting more inspections going, but looking at Haringey, we've got 33%, I think it is. 34% of places have not been inspected, and although 59% are good or outstanding, and we are, as you've said, well rated, it is worrying that so many have not been inspected. Is this the same? Is this similar to other places, or do we have an extra high amount of places that haven't been inspected?
No,
Thank you.
No, you don't at all. I think Haringey, it's a national issue. It's not a local issue. So there is no difference between Haringey, Enfield. I'm dealing with Haringey in Enfield and Barnet, which are very, very similar. So it's Haringey is not higher or lower than anywhere in the country.
Just quickly on that point, how would a care home or a home, how would that be opened without being rated?
Well,
Surely,
once a service is registered, they can provide a regulated activity. They can take on service users. More often than not, they will go for private provision, because councils will generally not place in services which are not rated.
So does that mean that then, therefore, that we have 33 homes in Haringey which are operating without any regulation? Is that correct?
That's incorrect.
This is not blame. I'm just
no.
shocked.
No. That's incorrect. They still have to adhere to regulation. So they still have to work within the statutory requirement of the law. It doesn't mean that an unrated service automatically will also provide services. So we do have a lot of services out there which are unrated, which are seen as dormant, and they don't carry out a regulated activity at all.
So of those 33, how many of those are carrying out a service?
I would need to go in greater detail in there. I don't have them figures on me at this moment in time. Apologies, but I can provide these figures.
So going to Richmond, so from your perspective, because obviously you're the Haringey person, so what's you're the officer here, so could speak tonight to the service. So what's your understanding around the information that we've got in this report around unrated services? Do you think this is a concern, and are we pushing for these to be speedily inspected by the CQC, or are we not placing people within these services? Thanks.
We've had a policy for the past maybe 5-7 years where we don't place with any provider in Haringey or out of Haringey who does not have a good or above rating.
So residents in Haringey may well be using this service, but we as a council wouldn't be placing them. Is that correct?
We as a council don't place with them, and if any resident in Haringey wishes to use a registered service, they can always come back to us. They can contact us and we can point them in the right direction to the ones who are rated.
Councillor Poku.
Thank you. Just going back on what you've just said, Richard, then. So if I look on page 2 of the supplementary pack itself in the table, so where it has in borough commissioned by London Borough of Haringey, it has 4 that are not yet rated. So were these 4 ever rated and they just haven't gotten to it as of 2024-25, or I'm just trying to understand. Yeah.
What happens sometimes is providers change hands. So when they do change, when a provider who is normally rated good, if they do get so, then CQC would require that provider to kind of re-register, and that's how we end up with people with clients in provisions which are not yet rated. But at the time when we made the placement, they were rated good.
Can I ask a follow-up? And just out of interest, so if they've changed hands and it's not yet rated, but you still have service users in there, how long do you leave them in there before they get rated? So let's say 2-3 years time is still not rated. Do you still keep them in there, or do you move them elsewhere? Because the council is commissioning those services.
We do have very quarterly meetings with CQC, and we do bring up these providers that we think they should prioritize. And also we as a quality assurance team, we do focus on those provisions which have changed hands. And so we tend to go there and visit them quite a lot more than we would with the other providers who are already rated good.
Yeah, no, thank you for this. Looks like you're going in the right direction. I think it's generally an improvement from last year. So I think I just want to put that out there. I do have a question in terms of the number of providers that you're using. You've dropped by 30 compared to last year. I just want to understand the reasons behind that.
I mean, the provider market has been, it's been quite tricky recently, and quite a number of, and this is not just Haringey, there's been a number of providers who've actually exited the market, and that's probably one of the main reasons. I mean, in Haringey, I think last year we only lost about 3 or 4 providers, but for a borough like Haringey, that's quite a massive drop. But if you look at it nationally, it's what's happening across the UK as well. There are a lot of providers actually exiting the market for whatever reason.
I mean, the concern I have with that is the cost of the services that we have to then run, and the challenges that we face, particularly given the costs within the services already. What are you going to do to mitigate this going forward? Because if you have fewer providers, then those providers essentially can push up the costs to the council, right, in terms of the services they provide.
If you can tell you now. Sorry, I think it might be a bigger question than to Richmond, if we're fair to him. I'm going to say something and then Zara want to say something. I think you're right, it's a massive issue. And you know what I'm going to say, the thing I've said before, which is it's a symptom of a system that isn't functioning and isn't functioning healthily. I might fill in a gap that Richmond didn't want to, which was around why people might exit the market. They might not feel it's as financially profitable, or they might well have, they often work across a spectrum of different types of support, and they might find that some bits are more profitable and more interesting. Some providers are small and they struggle, and other providers will go where the market is most strong and most profitable. But I think it's a massive symptom of a system that doesn't really function well. And in my opinion, as a politician, probably doesn't always deliver the best value. And I think we'd dearly like to see something that worked differently. That's what we're busy and advocate for every day of the week. But Sarah might have some things to say a bit more on the service front.
Thanks. I have a couple of things to add to that. So one is just we have obviously an annual uplift regime with providers. We're just in fact finalising what those proposals for next year will be, focusing on benchmarking across North Central London, and also being really cognizant on what is a sustainable price really for providers to be able to work to, pay fairly, and also ensure that they're sustainable as as an entity. It's also worth noting wider national conversations in this regard, which the panel might be aware of. There's discussions around the Fair Pay Agreement and what that will mean for the sort of care workforce more longer term, with sort of national bodies being set up to support that. And so I suppose there's those conversations at a national level which will impact. But what we do is work with providers, and we have sort of annual uplift conversations with them and mechanisms for benchmarking and ensuring that there is sustainability for them, recognising the challenges within the market. And as Joe said, in response to one of the earlier questions, I might want to add, actually we've been doing a lot of work with providers this year. So now monthly meetings where Joe and colleagues and Richmond will meet with the providers. So we're seeing those kind of, if there are early warning signs or real challenges, that we work with the providers accordingly. So it's really important for us to work within that wider sort of North Central London context, noting that actually a number of our placements are out of borough as well. So that collaboration that we have through the North London councils is critical to kind of maintaining those dynamics and relationships with other local authorities, providers, and managing, the market and understanding the challenges for the providers. But Joe, you might want to add some of that through those discussions that the team have.
Yeah, just briefly, I think Richmond and the team have been meeting with providers monthly for a long time on online forums, a very efficient way of meeting with people, as we all know. But we've had face-to-face sessions with providers as well, and I think we've got one coming up, haven't we, Richmond? I think in the absence, not everything's about money for the providers, and I think sometimes we get a little bit stuck with that narrative. Some providers start out in the business for the very best of reasons, and I think it's important to us that we try to protect, particularly the smaller providers that are good or outstanding, wherever we can, because it becomes more and more a case that the bigger cats stay in the game, and the smaller ones are more vulnerable. But I think what we found is they're really interested in joined up approaches to integrated workforce development, how we can better support people who are frail. We're doing a bit of work at the moment looking at pressure sores, which are a common theme for us in social care, and definitely for our providers and our care agencies. So I think there are real opportunities to further strengthen the relationship with providers. And actually the commissioning team in Haringey, I was really impressed when I came here. I think relatively small team, but they've got really good, strong relationships. They put a lot of work into that, and it's really paid off for us.
I've got a couple of questions for our CQC colleagues. So I just wanted to draw our attention to page 5 of the supplementary pack that we've been given, and it's really about quality assurance team, our Haringey quality assurance team. It said they reviewed inspection histories for Haringey services and raised concern about the low inspection frequency for some providers. Now, I know it says the chair of Haringey Safeguarding Adults Board has formally escalated these concerns to the CQC, asking how inspections would be prioritised and what interim safeguards would be in place. So I saw the response below that is indicated it is prioritising, not yet rated, service inspected no more than 5 years ago, and those required improvements. But I just wondered if you could flesh out a little bit more this evening, anything more specific in terms of to provide assurance to us as the scrutiny committee and to our residents around the ability of the CQC. And I know you did briefly touch on all the issues that you have currently been experiencing, but how do you think you are going to be able to prioritise these inspections in a way that allows the quality assurance team and the chair of the Haringey Safeguarding Adults Board to have that assurance that everything's been inspected in the way it should be? Thank you.
Okay, I think the first thing I need to add, like since November last year, we've changed into specialist teams again. So in the past, we were generic teams, which were kind of like all 4 directorates, which is like health, social care, mental health, and PCNC. Now we have specialist teams since the 1st of November. We can already see nationally and also within my team that we have increased inspection activity as it is. So that's very, very positive. As a team, for Haringey and for my team, we meet on a monthly basis to review risk, review inspection activity, and prioritize inspections. So we already know, for instance, what we are doing, well, obviously for this quarter. We're going to look into next quarter by the end of this month and plan inspections as assessment for that quarter. We obviously look at services which are have the oldest rating, and services which are have no rating, and services which are at high risk, and will prioritize them accordingly in line with our inspection priorities, which I mentioned earlier on. And as I said, there's a lot of work going on internally of kind of like streamlining the process, which ultimately should help us to be much faster in us carrying out inspection activities and do more inspections as we do already.
So I think the sort of question is, over what sort of time frame do you think you'll be able to enact this approach in order to reassure us and the chair of safeguarding that these inspections are timely enough?
We already increased our inspection activity. So by this time we already carried out more inspections this year as we carried out by November last year. So we already increased our inspection activity nationally, and that goes for Haringey as well. We currently introduce on a regular basis new ways of working. So I know by the end of this month there will be something coming out about reducing inspection reports. We are looking at the moment at artificial intelligence, and hopefully that should be in place by the end of March. So there's ongoing work going on for us to speed up what we need to do, and we know we need to do that. We are not blind to what happened over the past 2.5 years, and that we haven't been out as frequently as we should have been.
Thank you, and that'll be really helpful to see in a future report around how that's improvement, and actually what the reflections are from the chair of Haringey Safeguarding Adults Board is in terms of next year's cohorts of inspections, whether they feel that quality assurance has been met or is on the way to being met. That would be really helpful. Thank you. Any further questions from the panel? Okay, so thank you, everyone. Thank you very much to our CQC colleagues, for Mohammed and Andreas, for coming to speak to us, well, online speaking to us this evening. It's really helpful to have your perspective. We ask challenging questions, but that's only because we want to understand what's happening and ensure our residents are getting that best level of CQC inspections going forward. So thank you very much for coming on, and thank you, Richmond, for coming in from the team tonight from Harringay to go through the report with us. So thank you very much.
Thank you. Bye-bye.
Thank you. Bye. So the recommendations from that were that for the next report that we get that level of assurance from Haringey's Adult Safeguarding Board Chair, that they've, with the quality assurance team, that they've they've had those meetings and they've understood how that is working and if it's working well or not. So we get that back in the report. So thank you, Richmond. Okay, any other recommendations on that? No. Okay, thank you. Right. So moving on. We have got agenda item 9, which is the financial update. We've got Rachel Boston come to speak to us this evening, which we're very grateful that she's able to be with us this evening. This is in the main pack. This is pages 17 to 52. I've had a quick word with Rachel beforehand and warned her that we always like to have a bit of an oversight, but just sort of laying the sort of stage as it is, because obviously we've got the cabinet report, which is out and in the public domain, but we're actually looking at the Q2, which was published a little while ago now. So I'll leave it to you to sort of set the financial scene, and then as councillors, we will then go and we will then continue looking at the pack and focusing on the specific savings that were put forward from the council, and ask more in-depth questions on those. So that's agenda item 9, page 17 in the main pack. Rachel, over to you.
Thank you, Chair. So just to put things into perspective at the Q2, in the report at Q2, we're reporting a favourable movement at that point. So one of the things that we've been working with the services and we've been doing is just sort of like a root branch review of the budgets, just to make sure everything's been properly accounted for. And in Q2, what we were able to identify was an additional 1.8 million of income that we hadn't fully accounted for within the accounts. So what that had the effect of doing is actually reducing the cost pressure we had in placements. So that's what we did. What I would say from that is that work has constantly continued in the services, and what we are seeing, and what we will continue to see, is a reduction up until the end of the financial year of the cost pressures within the placement budget. That's quite positive. Also, in terms of the performance that is supporting that activity, we have in our older people services seen much more of a stabilisation. So actually the numbers aren't going up, they actually have reduced. So at Q2, we've got a position, but actually I can say to you as of today, we've actually got figures that are lower in our older people category than we had at the end of March 2025. So the trajectory is lower or stabilising. Obviously, there's more work to be done as to understanding what is the reasons for that. But where we currently stand, it doesn't mean that people aren't being provided with their services. It's just that the numbers are actually going down, and therefore the average unit cost is going down as well. The areas that we still continue to see growth is in that category between your 18 to 64-year-olds, predominantly within your mental health and physical disability. So although that may in itself be a concern, one of the things we've been doing over the last 3 months is working very closely. The service has been working very closely with the ICB. So even though we're seeing a corresponding increase in the costs for mental health and in those areas, we're actually seeing an even better increase in our contributions from ICB to support those packages of care. So with that reduction in the older people services,
our placement activity, because we know we're doing work around the inflation and we've worked with the market very much so in terms of that sustainability and those fees, and the fact that we're getting increased contributions from the ICB. That's why we're expecting it all to sort of like start to reduce by the time we get to the end of the financial year. That's a summary position where we are.
Thank you. That's really helpful. So well within the time. So thank you very much. It's nice and succinct. So I'm going to look to my colleagues if they want to start with a question. Councillor Poku.
Thank you, Rachel. My one is just a comment that you made that you've seen the growth in 18 to 64-year-olds. I think what would actually be helpful is a further breakdown in that age group, because it's quite a large age group. Because that would help identify where the problems are, because it might be that the problems are 18 to 30 rather than 40 to 50. You know, if you can break that down a bit further, that would be useful.
So as I said earlier, it's certainly within the 18 to 64-year-olds, you've got a lot of younger mental health. We are seeing a lot of younger mental health before the ages of 35 coming through the system, requiring a lot of support. So we've got that coming through. Interestingly, in the physical disability side, which we never had before, it's that category from 50 years old that we're suddenly seeing them come through and requiring support, which you never had before. So you've seen more 50-plus-year-olds rather than the 65-year-old with physical disabilities coming through for services and requiring long-term support, as opposed to short interventions and then back out of the system.
I'm just going to ask a very sort of broad question before we get down into specifics. So on page 19 of the financial update, Q2. So listening to what you've just said around the pressures dropping in older people with old people. At 1.2, you've got the financial forecast for Q2 is 23.4 million overspend, which is an improvement of 10.7 since Q1. And so we've got the forecast overspend of 23.4 million and then the additional 37 million of EFS. So are we saying at this point that actually we're going, you know, in a really good direction and actually that overspend is being reduced even further? We don't have to have specific numbers, but it's nice to know, you know, if that is the direction of travel.
And I think there's a couple of things with that, just to put it into context. So yes, the overspend will reduce further in this year. Just want to be clear about in this year, purely because of that the ICB contributions and basically because we are working with providers. And one of the things we've seen is the inflation that we thought we would have to pay providers to be sustainable has not been as great as we've expected. However, what we do need to do is therefore recast our demand modelling and any of the pressures we've got next year, which includes ensuring a sustainable market. Okay, and then that will give a very clear position about what that budget needs to be looking for going forward.
Any other questions on the main? Yep, Councillor Inherent.
Yeah, no, thank you for the good news, to be honest. I think we've used some of this after such a long time. I think even in Q1, we saw that the older people services, the demand was stabilizing, and we did ask those questions as to why, which in a sense is good news. Maybe my question, I don't know if you'll be able to answer, is do you think that's the general trend that's going to continue, and for how long? And my other question is obviously the growth in the 18 to 64. So at the moment, it seems like the fact that you're making some savings suggests that the cost of the 18 to 64 is not as high as in a sense, there is a gap between the two. I just want to understand what that demand rise is going to look like going forward, and what's the projected cost to that service.
Should we share the love on that one? So we've been doing, I mean, it's really hard to predict with demand-led services, as you will appreciate. The point on the 18 to 64 and why the costs aren't going up necessarily in accordance with that. It speaks to the joint funding and so it's not all council council expenditure as it were. So that will be that joint income will reduce and gets to a net position. We in terms of next year's budget, because we're obviously doing that sort of forward forecasting now, there are many variables that we have to build into our modelling assumption. And in fact, we are largely running off of 3 different models, which then speak to each different cohort, which then applies a methodology and approach to that. It then applies what we think will be assumptions around inflationary pressures and everything else, because we've only today had the funding settlement from government as well. So there are various factors that speak to that. So what we are working on are 3 scenarios for variables on those on that demand. And yeah, so it's I can't give you a specific figure because each line, mental health will be different to physical disabilities, will be different to what we expect to see in the home care or supported living, and et cetera, et cetera. But I suppose just to provide assurance that those numbers, so Rachel and Neil, who's been to this panel many times, we've done a lot of detailed analysis to improve our modelling and forecasting, and that's why you're seeing in the numbers now that stabilisation, which is kind of consummate to that. However, as with the type and nature of these services, we do expect that there will be unexpected peaks at times and volatility in that demand for a number of reasons. We know when there's a particularly bad winter, how that affects demands on social care. So I say it with that caveat, but I think we are in a much improved position. If you look back at where we were in terms of last year's performance, where we were against budget profile, actually that was considerably higher in terms of the overspend position as to where we're at this year, which I think is a demonstration of that work coming through. But yeah, it's incredibly hard to predict, and we are using as much data as we can to inform that, and we're in a better place as a result, but it is very variable to a number of component parts.
Thank you. So I was looking on page 26 for Q2. So this has got the movement from Q1 to Q2. And so the second line down, which is the adults and health services, with the housing taken out, I'm assuming because housing demand is underneath. Yep, great. That's great. Thank you. That's really helpful. So just checking. So we've got the Q1 total variance of 7.5 million, and then we've got the actual total variance of 5.7 million. So that's the direct, that's the bit that you were talking about, that's the savings. So that's captured in the 1.8 million. That's the improvement between Q1 and Q2. And is that including the ICB money? No. Oh, sorry. Okay, no, I'll just let you answer. Sorry.
Yeah, that's okay. So that 1.8, yeah, there is more to come. So that 1.8 is very specific to the grant realignment that we've done, which has gone against the placements activity. Okay, so just to make it clear, what we are saying is we are expecting from it to reduce from 5.7 further down once we do all the allocation of the ICB, because we've been working with the ICB very closely and the service and ourselves together collectively over the last 5 months. And we've actually got some formal agreement with them now as to what they believe that joint funding arrangement was and is and should be into the Section 75. So it's been a very different approach, which means that we've then got much more assurance, but it's taken a long time to get there. But it's fine.
So it's good to see it going in that direction. So Councillor Mason.
Thank you. Thank you, and thanks a lot for the paper and the information in it. I maybe don't quite understand this, so it's probably a naive question, but I'm looking at General Fund 1.2, where on page 19, where you say there's a forecast overspend of 23.4 million with an additional 37 million from the exceptional finance support from, yeah, this is on 1.2. Yeah. Oh, sorry, page 19, paragraph 1.2, General Fund, okay?
It's the start of the report.
Right at the start of the report. Have you all got that, yeah? Okay, so I then wanted to flip over to page 26, okay? So disregarding everything in between, no, not true. No, I'm joking. Have you got different pages or something? Oh, apologies. Yeah, I'm not online. I'm on paper. Yeah. Yes, it's overall, yeah. And then I'm looking at page 26. And what we've got is the movement from quarter 1 to quarter 2, which actually doesn't show a very large variable, but it's there. What I want to know is what your projections are for, we're now almost, we have finished quarter 3. I know you might have all the figures, but we have finished quarter 3 and we're into quarter 4. And so what I want to be aware of is the danger that we face in terms of what's going to happen in budgeting for 26 the year we're in, what are we in, 26, 27, in terms of what we expect the overspend to be, and also what the issues are about repaying loans, particularly around the money that we might have received in addition from central government, because I'm not quite sure what those returns are. But I know that last year we were told that the money that we borrowed from central government under the exceptions fund would need to be returned within a certain time frame. And I just want to be reassured around that. Thank you.
I'll come in if I may. So the budget report for 26, 27, the draft budget report, which is the overall, is available, and we can circulate that to panel members via Dominic, and that report fully sets out all of the questions that you have answered here. We focus on the adult social care only, so it's really difficult for Rachel or I to respond, and that would be but we can get you the draft budget report which will set out the 26-27 position.
Right. The reason why it's exceptionally concerning, obviously, is that adult social care is one of the 3 areas that makes up so much of the overall budget, which is what my concern is.
So my understanding is that's the cabinet paper, isn't that's coming to cabinet tomorrow? So the papers actually are out, which is really hard because I was having to ignore those and concentrate on this because we were doing quarter 2. But yeah, so I've had to do a juggling act in my own head, so I wasn't confusing 2 sets of figures. Councillor De Snevis.
Just wanted to say, totally understand why you're asking the question. But just to say, we don't really have the right people here in the room either. It's really we'd be airing that, and we'd have Tara in here and Councillor Carlin. Totally appreciate our portfolio does play a significant role. You're absolutely right. And we will have answered those questions partly through some of the budget sessions that have been held, if that makes sense. Just don't think Rachel or Sarah can really answer those, the broader, bigger picture ones.
Yeah, Dominic.
Also just to note that in March on the Overview and Scrutiny Committee, which I think is March the 11th, we'll be looking at the quarter 3 figures, but also there's the opportunity to ask wider questions about the 2026-27 budget and MTFS. Taryn and Councillor Carlin will be at that meeting. So any questions that any of the panel members want us to bring forward to that meeting, they can do so tonight, and we'll take that forward for the March 11th meeting.
Right, thank you. There's an awful lot of finance, isn't there? So, right, so page 27, sticking to adults and health, on the total savings at table 3. So I've got the top line. So I've got the green is £2.2 million of savings, and amber and red, I've got roughly about 1.7, which are savings that, so there's obviously the red, but there's a 1.3 of amber, £1 million of savings in amber. So really, I suppose the question is, looking at these overall saving figures just within adults and health at quarter 2 tonight, what's our assurance as a committee that those amber figures will be reduced so that we will make greater savings within that area? So more green, so obviously helping with the budget.
Yeah, I think there are a couple of things. As we've said in the report, we did have some delays with onboarding our new commissioning staff. They're going to make a massive difference to the service because they will lead on the savings delivery next year and going forward across the service. So that's one key piece. And also we did get very much held up by NRS and provider failure, where we were very much focused on that for what, 3-4 months, wasn't it? Where we were very much as a service all focused on NRS. So I think that they're two key pieces. I think the other key thing around the savings in social care is that there's lots of interdependencies with other areas of the council who are also trying to make savings. So, you know, just trying to strike that balance of engagement with digital and HR and economy or placemaking and housing, obviously, and children's services that are cited within the report, and also focus on our own areas of savings, where we're the lead, is something that we've got a lot better, I think, haven't we, Sarah, over time? But that would be just something that I would point out. But commissioning is key. And we have 3 new strategic commissioners in post by May. So some of the savings that we haven't addressed this year will be rolled forward. So they won't be lost. They'll need to be addressed. They'll need to be found next year, 26-27.
Okay, thank you. So we're now going on to the page 43, which is the savings. We are going to go through in more detail because that's what we are here for tonight, and Rachel is briefed for. But I just wanted to say I found it really easy in the capital one because they've got the reference numbers against them to sort of cross-reference and go back. So on the capital forecast, this is just a general point. Under capital forecast on page 50, you've got the scheme reference number, and then it's easy to track. So you've got aids and adaptations is 201, whereas within the savings, we've got transitions, but we don't have a reference number against it. So I'm just wondering, if possible, whether it's possible when we do savings, just have a reference number, because it then is a lot easier to track back, because sometimes the savings are, you know, you've got here cabinet decision date, which is brilliant, and I really appreciate that because it does tell us when that was originally put forward. But I think it is just really helpful if we are going to have rolling savings to have it tracked. Sarah.
We'll feed that back, Chair. I can't promise that for Q3 because I think the papers will be in draft format. So if I may make that as a recommendation through to our Section 151 officer for next year, we will take that back. Thank you.
Absolutely. That was just a quick one at the very start. So thank you. Okay, so right straight on to transitions. So that's our first one that we're looking at today. So we've got the comment on the RAG status delivery. It's green, but there are some savings shortfalls within that. So just checking if there's any questions from panel. Councillor Brennan.
These staffing savings for adult social services, is that just reducing staffing? Just employing less people? Because it sounds dodgy to be doing that.
So in the main, the staffing savings were where we had either supernumerary or agency roles, and we did have an increased number of staff in to support CQC inspection. So they were sort of one-off roles that we don't necessarily need longer term, and this really was a realignment and reduction in those areas where we in essence don't need those as permanent roles in the structure. And we've done a lot of realignment. You will have also heard when I mentioned earlier, we are actually increasing capacity in the front line. So this has come with a reduction in the areas where we don't need those roles, and will be sort of offset by the extra capacity that we've taken on board. There are some other changes in sort of management roles as well, but in the main, it's all reconciled against profiling the resources where we need them to deliver the service, and will be offset in part by the extra for next year. Thanks.
I'm going to ask if we stick to the order. So you went straight to number 3. Well, I was pausing on transitions to give you a chance. It's all right. I could see your enthusiasm, so I thought that was worth following up. So I just wanted to check, Sarah, I completely hear what you're saying about the staffing, and I am going now to that third one because that's Brendan's started with that. But I just wanted to make sure, because in supported living contract, the savings were read, and it's in part due, and one of the 3 bullet points under that was the commissioning team capacity. So it's not, we're not losing staff from those key teams.
No, absolutely.
Back to transitions. Okay. Any questions on transitions? Because there's quite a substantive drop in figures here. Okay, so I'm going to ask, so the expected cost of transitions is much lower than forecast in 2023. So it's 2.9 compared to 4.2. Now, I know we've discussed this before. I suppose the question that underpins this, though, is around the robustness of the data. And you're talking about that planning. And I know we've brought this up before, but it's probably another opportunity for you, Sarah, to sort of say, what exactly are we doing to ensure that these are more robust in the future? And also, if this is, the concern is that, okay, there might be a couple of years where the figures drop, and I'm assuming that the data from children's is robust. So that's what but if it goes up, have we got already that put into that trajectory?
Sorry, I thought you. It's a competition. Yeah, I mean, Neil, our finance colleagues have done a huge amount of work in this space with children's services and ourselves. And I think largely the transitions data, we've just got a real grip of it because largely they're a known cohort. They are, aren't they? They're in school. We know them. They're in our schools. The majority are, and we can plan accordingly. There are some outliers, some young people that are surprises that come through the service, and we haven't necessarily forecast them. But I think what we did, I think it was about 8 months ago, we really got a grip of the data. And what is excellent in terms of our collaboration with Children's and Health is that we have really great governance on transition. So I jointly chair with Dion Thomas, the director in Children's Services, the operational group, and Anne Graham, our DCS, working very closely with Sarah, chairs the strategic group. So we have all the underpinning governance around transitions that we didn't have initially, I think maybe 18 months ago. There's always more to do. Because there are people that are not eligible for services, for instance, those that might not have an education, health and care plan. I was with Send Power today just talking about that particular group of young people who we can't plan quite as effectively for, so who may not be eligible for services when they're younger, but then develop complexity as they get older, maybe mental health issues, behavioural issues, a combination of things. But largely, our data on transitions should be good. So this is a really good leap forward for us, I think.
Okay, so on transitions, sorry, is this a question on transition? Okay, yes, please ask.
Yeah, no, thank you for that. I do have some concerns though, because Rachel had just said that the costs of the growth in 18 to 64, particularly around mental health. And I think my concern is, could we be underestimating some of the issues and maybe not investing enough in the service? I mean, it's an open question. I'm not making a judgment here. I'm just seeing that there's one stat that says actually there's a growth in this area, and another saying that we're actually trying to reduce some of the costs. And it's the modeling. Are we just certain about the modeling that we're using?
Okay. What I would say, only because I happened to be there at the time, the modelling for the learning disability cohort was done at a point in time, I have to say. And I would say that the robustness of the data wasn't as great, if we're being honest. What we have now got, as absolutely Joe is saying, because we've got that strategic view, both in terms operationally and the data sets, What is now happened is that we've been able over the last 8 months to profile that data and cohort much better. So, and we've aligned it with children. So we've aligned it with their SEND activity, with their safety valve activity. So yes, you're right. We know that we're going to have a reduced number for this year. We potentially have a reduced number for this next year, but it shoots up in 27, 28. So that profiling has already happened. And as Joe says, we know the children, we know those young people. The only time that you will then see that that cohort needs to be revised is quite clearly the bit we do not capture and you don't ever know are those children who move in borough and the needs that they've got as they move in borough and therefore what that's going to look like. So there's always going to be some movement, but I think broadly speaking for the data sets we have now, it's a bit more stable.
Thank you. The question I wanted to ask was about the, so there's a decrease or a decrease in or increase in savings. The issue I want to raise is the number of people, young people who are going through transitions who have raised or whose parents have raised a legal challenge. There was an increase in I suddenly had 4 people last year in my ward who were challenging the decisions that were being made. They didn't seem to be unreasonable people. And some of them were, one of them was somebody who was waiting for an autism, what do you call it? Help me, diagnosis, yeah. And who had significant issues, but had to wait well over a year for an autism diagnosis, which I think is not unusual now. And meanwhile, they were being told that the only programme available to them was one which both the child, the young person, and the parents thought was not something that they could use. So they had pursued a legal case, which I wasn't happy about because I kind of felt like surely we should be working with those people to try and achieve what the family wants rather than having to go into court. And so that's it's an expenditure. It's time and money cost to us, which could be resolved in other ways. So has there been an increase in legal challenges over the last 2 or 3 years? And how many people have we not been able to provide what they wish for in transitions?
I definitely don't have the data, so
No,
but
sure.
I'm happy to take that away. I think so. I was with Send Power, the Parent Carer Forum today, having this exact discussion, and I think parents, you as counsellors will know, a lot of parent carers with children with education, health and care plans will be used to the language of chasing, progressing legal challenges. It's just the way of the world of children's services and of parents, you know, challenging what they do or don't get and how fair they feel that is or isn't. I think what's more challenging when they transition to adulthood is the services and support available, the funding available for adults is much less. So there's not speech and language therapy usually, and there's not occupational therapy. A lot of the wraparound support children receive at school, it changes when people transition to adulthood. So it is absolutely in our collective best interest to work with Send Power and Children's Services and our schools and colleges so that we can start managing expectations from ideally around age 14. Because you start worrying about your child at 14 about their transition arrangements, and that mitigate against people feeling desperate and progressing legal challenge, because it is a fruitless journey for many families, massively stressful, massively expensive, and really if we get in there early enough we can plan, as you say, around the child or young person and do our best, which is all we ever try to do. It's often late planning that informs people progressing legal cases, in my experience.
I completely empathise and sympathise with you, because I don't think legal is a route that people necessarily, that is usual fruitless. So, but in 2 of the cases that I had, they were late diagnosis. You know, at 14 or 15, they started not to be able to attend school, and there was clearly problems, but they couldn't get the autism diagnosis. So that then meant that they weren't properly diagnosed. They come to reach their transition, and of course they don't have the proper diagnosis, the proper understanding, and the proper whatever. So there is a desperation from the parents. So there might be very many cases, but that's what I was wondering. Is that a group of cases? Can we treat them slightly differently in terms of recognising that they were late diagnosis cases? The planning didn't take place at 14 because it couldn't. And is there a way in which we can progress those cases in future? If I just happen to be unlucky and got 2 of those cases in screen, fair enough. But it obviously raises a bit of a concern that this is going on across the borough.
I think it absolutely will be going on, because it's the issue that we were talking about earlier. You know, people are not, our children are not all developing issues and complexities at the same time, you know, like ourselves as adults. I think Children's Services here do a really good job in this space. I think they've got a family support team to try and mitigate anyone falling off a cliff and not getting the support they need. I think the crucial piece you've spoken about is that it can take up to 2 years now to get an autism diagnosis, not 1 year, it's 2 years. So I think there are many, many risks there. And just on Sarah's point earlier about our early intervention team, our independence and early intervention team, I think we've got to ensure that we have them wherever we can focused on early planning around that transition, so that it mitigates against them not accessing any services and support for maybe a year or 2 years, and dropping off the radar almost, which there are a whole load of risks there, clearly.
Okay, so now I've got Councillor Neves, Sarah and Councillor Donovan. So Councillor Neves, did you want to come in at this point?
Just speak to that, and then I did have something else, if I can remember. It's gone in and out. Chair, that might also be quite an interesting topic for a joint adults and children's, because if you'd allow me, you know, you can tell me off if you don't want me suggesting things for that, only because I think that what the councillor's talking about really would still sit within that young person at age 14 or 15 would still be in the children's service. But of course, the difficulty will be by the time they've got their diagnosis, they're almost about to leave it. So it's so it's quite understandable why they might not be quite the right thing for them, because actually they've possibly never had. But I think there's a conversation, and we want that expertise from children's in the room about how many and how much. I remember my previous point, which was about just making the distinction, if you'll permit me as a non-expert, between the mental health in 18 to 65 as different to the transition, which is probably we call more of a LD cohort. There might well be a crossover there, but probably they probably are quite different. There's kind of autism, LD, and then mental health. I think that's fair. Yeah. Okay. Just kind of speaking to your point.
So, same point, excellent. I'm going to come back to Councillor Neves. Sorry, Councillor Donovan. It's just because in front of me, I have so we obviously put our recommendations to Cabinet, because the Cabinet report is now out in public. That's exactly what Councillor Neves said as part of this transition bit. She actually said that we should be looking at this with the joint children's and adults scrutiny. So I was going to put that out at the end. So I'm glad she's repeated exactly what she said as part of that recommendation. But yeah, so it was said that around the data particularly, we will arrange for the next joint children and adults open scrutiny with agreement of the chairs to have the further scrutiny of the data around transitions. So I think all the points brought up today, I am in contact with the chair of Councillor Lawton Children's, and we are looking to put in that joint children and adults scrutiny, because we normally do have it around February time. So we're just looking for a date at the moment with officers for that joint. But obviously we need to agree an agenda, but that was a recommendation that came through from the transitions that we put through, and that came back from Cabinet. So we spent quite a long time on this. So I've got Councillor Donovan, Kathy, so Councillor Brennan, did you want to, okay, a small point, but Councillor Donovan first and Councillor Brennan, and then we'll need to move on to the next savings. Thanks.
Okay, thanks, Chair. And unlike you, I've been looking back on some past reports that we had, and back in May 24, we had information about the new service. Sorry, the Haringey Integrated Transition Service. And as part of that, it was talking about cost, they called it cost avoidance over 5 years of £4.5 million. Is the fact that is this reduction that we're seeing now, is that evidence that the transition integrated service is working?
Yeah, I think that would rather depend who you asked. Yeah, you're asking me. Well, I would say it's working for the people that are supported by it. So they've currently got, the team have currently got 50 cases, which is fairly hearty. But there will be many other young people we could be working with and families. I think if we were working in a more integrated way with health and adults as well, which is our endeavour now, it's to really come together as an integrated team. They are definitely making a difference. And the other key piece that Jackie DeFalco has really championed is that the transitions piece is only one piece. It's the housing, employment, leisure, living a full life, being visible in your community, elements of transition that are equally as important as education, training and adult social care. So there's still a lot to do. But they are bedding down now. They've been in place for a good year, haven't they? When I started, they'd just started, and I think that, yeah, they've made great inroads, but it's a huge endeavour, transitions, and I think we haven't quite got on top of the year 9, starting from year 9 at the earliest opportunity. I think there's more work to do there.
Okay, Councillor Brennan, one last quick point.
Very quick question. I just want to myth bust, actually. One of my residents today was saying to me that people could go, that private companies were setting up so that they could actually do the assessments for educational care plans. Is that actually a real thing?
Oh yeah, that's been a case for a long time. So the previously they were called statements of special needs for people as old as me, and there were lots of companies you could buy in to do those, and similarly you can buy in companies to do EHCPs. You can buy in companies to do everything now.
Okay, so the recommendation from this committee is to acknowledge the comment made back by the Cabinet to our previous concerns around transition, around us taking forward this data and looking at this in a little bit more depth as part of the Children's and Adults Joint Scrutiny Committee. So, as I said, we're just looking for a date for that. And obviously this would need to be agreed with both chairs, whether we did bring this forward. But that was that came from the recommendations back from Cabinet to our recommendations. Okay, so we have done staffing savings for adult social services. So we're now moving on to integrated connected communities. So this is a £700,000 saving. It's Bragg rated green and it says it's on track to be delivered. I just want to ask colleagues around the table if they've got any particular questions on this. I've got one. I'm going to start off while I allow you to have a thought. It doesn't, it says these are projected 4-year savings. Actually, sorry, I'm Rachel. Are these at Q2, because this is our report, at Q2, were the savings, you know, how much had been delivered? Because I suppose what we're looking at is whether it's all supposed to be delivered right at the very end, or they're sort of savings to be going through as the piece. Sarah.
I'll take that. So as the panel will know, we've been on the journey and consultation and engagement with the team. That's now all complete and the service is integrated. What we were doing along that journey though is holding vacancies. So actually we are on track for that to be delivered in full, and that has been a 1/12 almost, because we've had vacancies all along the way. What I'm really pleased to report is actually a number of people have been, as part of this, been able to secure permanent roles at a higher level. So it has actually offered promotion for some individuals. There will be one compulsory redundancy as part of the change, but that was an individual that didn't apply for any jobs because actually they're moving out of the area. So it's been a really successful consultation exercise actually, and we took quite a lot of feedback as part of it. So yeah, it has been delivered because in part that was delivered by holding on to vacancies. So there'll be 17 full-time equivalent roles as part of the new team in Joe's area. That team at the moment is directly reporting to Joe for the transitional period. And then when we implement the new front door, which we spoke about, which will be in quarter 1, 26-27, so between sort of April, May, June timeline, that team will become part of that wider offer there. So yeah, all on track and already, to be honest, delivered.
Okay, any other questions on that? Okay, Councillor Donovan.
Sorry, perhaps I missed when you said it at the IEI. What is it called? The Independence and Early Intervention Team. Yes. Did you have a date for when that's going to be set up?
So they've been transitioned into adult social care now and are working on cases. We will do because we're doing all of the front door changes, what we will do in terms of wider comms to counsellors is they are kind of embedding, doing some training, etc. now, is when we do that, we will roll out a package of comms to counsellors, but we'll do it in one because it doesn't make sense to do it now when it's going to then reintegrate into the front door. But yeah, they've gone live. In terms of, 1st of Feb was the organisational structure change.
Okay, so there's no recommendations on that one. So we have got the next one. Look. So I've developing communities. Developing community support model, building on locality model in collaboration with NHS, housing, public health, voluntary and community sectors. That's quite a cohort to be in that. Okay, so there's a shortfall of 90,000 on this one, and it's amber rated. Any questions? I had one. So when I was looking at this in a bit more detail, I was coming to the conclusion that this relies on more of a change in behaviour rather than necessarily around the sort of service aspect. So rather than direct budget cuts, have I got that right, that you're looking to change rather than particularly on those cuts? So what happens if that doesn't transpire and that it's very difficult to enact that change? Is that why there's a £90,000 shortfall on that, or is that something separate?
No, so the front door and the review was completed before Christmas. We're not behind there, but we are going to make some considerable different changes to how we do our business when residents, just on Helen's point, when they ring in. So that will be a trained, I think we've spoken about before, a trained group of staff. You're right about culturally, it will be a cultural shift, but there will be some efficiencies within that front door redesign. Yeah. So at the minute we've got 5 front doors, 5 teams, all working differently. And sometimes you're passed from one team to another team and to another team. This will be one team that work for the helpline for adult social care, but they'll be trained, so there'll be a consistent offer, there'll be quality assurance. It'll be the digital piece will play into this. It will be more efficient in this space, but the efficiencies, the savings will be made through the front door redesign, which we're working on now. I have to go through consultation with staff.
So are you looking at, so the 90,000, I note you said it's restricted by social work capacity levels, which is now, resources now in place, and you're aiming to get that at the end. So Sarah, is this going to be a green at the end? Is this your expectation?
So we're working to mitigate any, as with the red as well, working to mitigate any shortfall. And this one is a combination, because there are some placement budget reductions whereby we kind of signpost people to community support and look at kind of packages of care to see how else they could be innovatively delivered in a way that kind of supports that you know, the individual by way of independence. So we do have some additional capacity in looking at those opportunities for community support alongside the front door changes that are detailed. So I would say that realistically, because we've been delayed on the timeline, we do need to look at a combination of in-year delivery and some mitigation. And we're firming up based on the Q3 analysis that we're doing, what that might be, what combination of that might be. So we probably will be able to get a more detailed breakdown at the Q3 report, but we're just waiting on a report of analysis on some of that work.
Okay, Helena.
Thank you. Can I just point you to the fact that you are saying with this 90,000 shortfall that your work is in collaboration with a number of places, including the NHS. So my question here is, with the budget cuts happening in the NHS, which are severe, they're not little, they're severe when it comes to the ICB. How is this going to impact your forecast here and also your next year's, the way the next year, because I don't know how much collaboration you're going to get.
I'll respond, Chair, if that's all right. So in honesty, we're seeing a real shift in dynamics in terms of the relationships with the ICB, given, as you say, there are some very dramatic changes, which when, you know, they're out to consultation at the moment for their structure changes, you know, and the 50% cut is not a universal truth, because there will be some teams that will be cut by more than 70% just to get to that overall figure. So I don't think we can be in a position of being able to work with the ICB in a collaborative way. It is going to be across both North West London and North Central London, and we will not see the in-borough support that we get at the moment. So what's really important for that is us shifting our position actually and being much more closely aligned and working directly with the providers. So we have seen, by virtue of the changes with the ICB, kind of significant improvements in our direct collaborative working with the Whittington, for example, with North Mid, with the North London Foundation Trust. And we are in a kind of collaborative approach that I'd really love to bring to the panel at the right time around the neighbourhood health agenda, where we're part of sort of a tripartite integrator leading that work. What does come with that, and I'm sure it will come to JOSC in due course, is the kind of national agenda on moving, they call it left shift. I find that term really difficult, because what does that mean to people? But really what it means is, you know, out from hospital into community and earlier prevention. And the conversations that are happening at a national level is actually, what does that shift look like by way of financial flow into earlier intervention and prevention? And the latest conversations are speaking about a 1% shift for that, which actually is quite significant investment in local areas, and taking a collaborative and integrated approach. Some of that may flow through in due course to changes to Better Care Fund, which won't be for next year or the year after. It'll be beyond that. But in essence, that there are significant changes in the ICB, which is necessitating us to have a different relationship with the providers. And actually that is where, you know, the ICB will strategically commission, but you know, looking at that collaboration, it has to be with the providers going forward, and we will have a very different relationship with a much bigger integrated care board.
Yeah, of course.
Sorry, Sarah, but yes, you're right. It's going to be huge. God knows how they're going to run it. Don't you think, though, that there is going to be a change in your budget as the new huge entity goes forward and says, no, we can't do this? I mean, we're going to have neighbourhood working, I know that, but I can't see that you can be that sure of how much you're going to be able to get from them. That's all.
Yeah, I think one of the areas that is still TBC is continuing healthcare, which for us, you know, speaks to the joint funding. It's still not clear what those plans will be. There are conversations about, and actually Whittington provides CHC already for Haringey, but actually some of that transitioning out in a different way, and there might be reductions there. So we need to keep really, really closely aligned. And we've done so much work with the ICB finance teams and with our own arrangements on CHC to get that to a really much improved and stronger stronger place. That will be one of our biggest risk areas, to be honest. So we're absolutely alive to that. And whilst the changes will be implemented in April, there will be a phased approach to ensure a smooth transition, and we need to make sure we are front and centre of those conversations. And I think JOSC as well will continue, and we don't know what changes might be required given the new arrangements, but I think some of those other functions that we've got will be critical to us going forward for that oversight and management of risk.
So just very briefly, because I know Councillor Nurse wants to come in, but so that you're aware, the JOSC will be here in March, and we are looking at the NHS 10-year plan, and directors are, I think your Dan is coming, I think. But it's hugely important to have that in the room approach when we're looking at as a JOSC. And just to let you know, the JOSC currently is looking to retain its current format. We're not looking to expand to the 13 borough massive super no version JOSC. So we are at the moment very sensibly, in my opinion, retaining that sort of, so it's a much as we've always done. So anyway, that was just a point of interest. But yes, so the JOSC is looking at this as well as part of that whole NHS 10-year plan. So there will be a lot of discussions, I'm sure. Okay, so I know that I had Councillor De Snevis.
Yeah, I just wanted to point out also the well-placed questions, Helena. We've obviously merged with North West London, and I look at that with great interest, because I know that they're publicly available figures, which I think I've mentioned at this meeting before. The rate of spending on CHCs is significantly different, higher in North West London than in Haringey, even when you North Central London, apologies, therefore Haringey, and one might extrapolate because and you might think there might be some differences population wise, but not that much. And we've always harboured that concern that where health doesn't pick up its fair share or a reasonable proportion, and it would seem to me reasonable to say that that should be fair across London, not least across the country, then of course people still deserve and have the right to care, and someone else foots the bill. So I think they're good questions to ask. I just wanted to come in and make the point that those are the challenges and some of the conversations that continue to take place really about the fairness and justice, one might add, of that.
Okay, so as a recommendation, I think we just note or we just highlight the fact that Helen has brought up around the financing coming through the ICB and the work that will be put in through the team here in order to ensure that we get that fair fair, I can't say fair funding, can I? Because that's a fair amount of money to come through to us in that. So I think that is a risk within this that Helen has highlighted, and I think we just need to be aware going forward that we particularly look at that and ask questions around the ICB funding on that. Okay, so I'm looking, nothing else. So I'm looking to the other one on review of council's reablement model. So this is projected for full in-year savings. It's on track to be delivered. Any questions on reablement?
Because I've had 10, 12 weeks of reablement and I'm not going to talk about it.
Well, that's very good, Helen. I'm glad to see you're here. So let's hope that was a positive. So I'm just asking, because obviously it's a saving on the reablement model, and we're talking about preventative and ensuring people don't deteriorate at any point. There's always the question when we're looking to make savings on reablement, which is getting people back into hopefully a good level of fitness to be able to go home, hopefully, for a lot of people. So is this a good saving for us to be doing at this point, or is this something that's we've been told that we should be doing, rather than, is this something that actually we're improving the service and therefore we're making that saving?
Yeah, I think within the CQC report, reablement fared well. It's a good service, although it's a very expensive service, and it's a very expensive service because it's very old-fashioned, and there are many things that require improvement within it. And Kim Christodoulou, the head of integrated care, has already made some of those improvements, but there are many, many more to follow. So she's had a development day with the staff, and they too agree there are many things that need to change. So I think it's obviously a lot of money, but it's a modest amount of money in the larger scheme of things. And I think she's actually done an initial report, which we've brought through internal governance, and we need to progress further, post a more structured discussion with staff about next steps. But there are huge opportunities for savings and efficiencies within that area of our work. So yeah, I'm really comfortable with it. It's not about cutting staff, it's just about doing the business differently.
Thank you. I look forward to hearing that when it's progressed more. So I think we could put that as against that, unless anyone's got anything. No. Okay. So we've now got a supported living contract, releasing efficiencies through a new contract model for supported living. So that's red. So I suppose the obvious question is this something that is, I know you've had limited capacity due to the failure that we talked about earlier. And I know that I think you already said that you're looking to come back and make that. So what sort of time frame are you looking at for those savings? Are you looking at literally reprofiling the whole thing for 26, 27?
I'm expecting the financial analysis on that literally this week or early next. So it might again be a Q3 for that for the breakdown on what proportion we do. There have been some as part of the community support model, some of the work that we've been doing as part of that will also impact the kind of independence offer around those in supported living and sort of doing some wider review of when cases come up for review, what those opportunities for community support might be. So I do expect that there will be a proportion that we can make in year, but the much larger proportion will be rolled into delivery next year. It's worth flagging there is a saving already earmarked in next year's budget, so it's a 1 million saving overall that was spread across 2 years. So it's 400k this year, 600k next, just to be really transparent on that. So we'll be looking to make up that shortfall in next year's budget. We are working with Rachel on identifying the areas for mitigation, and as we've spoken about earlier, because we are seeing some improvements in our forecast, we hope to be able to kind of net that off against opportunities in in other areas. For example, we spoke about some of our inflationary pressures have been less. So to bring us back to where we expected to be from a budget point of view, which will give us the time we need to deliver the saving as per its original intention in 26-27. We have had some external capacity do a wider review, and this looks at the procurement arrangements that we've got around our supported living, and that's how we will realise efficiencies and savings. So it's sort of a commissioning piece rather than anything else.
Just to make the committee aware that one of the responses back from Cabinet, so I can't sort of steps, I'm just going to read this out. So it says, ensuring residents receive the right level of support is central to how supported living is commissioned and monitored. Each resident has a support plan that sets out their assessed needs, and these are reviewed at least annually to make sure that the support remains appropriate. So that was, I think we had some questions around supported living contracts, and that was one of the part of the response we got back from Cabinet. The reason I picked that out is because we're talking about the review, annual review. So I know that there's issues around, reviews and yeah. So where are we in that, in sort of doing these reviews, annual reviews in supported living? Is this something that is currently happening, that it is annually, or is there some backlog within that system? Because I know there are backlogs in other areas.
So if I come in on, so this saving isn't necessarily predicated on that, but we are doing some supported living reviews, which will speak to the community support model. We do have areas on reviews where there is a waiting list where we are in a scenario where we do need to catch up and have the additional resources required to do that, and that's part of the capacity that we spoke about and that realignment across the teams by way of staffing budget. But this isn't predicated on that. This is a change of commissioning model rather than directly being linked to reviews. The reviews work will offer mitigations, but the actual substantive saving will be on changing our model of commissioning.
Sorry, I suppose what I was asking was that exactly that. So it's two different parts of the same system, but is there the financial capacity to employ the staff to do the reviews in the way that you're, hopefully to maintain the annual review? Are you looking at that within the saving? I know you're making the savings separately for the commissioning and procurement process, but is that being factored into those contracts and into sort of making sure that you do have that support for staff to be able to do those reviews?
So that's being factored in by way of our overall proposals around staffing and capacity and demand, rather than being directly linked to this saving. And we know reviews is an area where we need to ensure that there's more, I suppose, timeliness to the reviews, and there is a bit of a lag, and we expect alongside our improvement journey that isn't, we're not going to necessarily be in a position, as with many other local authority areas, this does remain a pressure area on capacity. So we will look to there being a stepped and marked improvement over our 2 to 3 year journey. So we want to be in a better position this year and then have that in a stepped way to get to where we want to be. But yes, it's not the additional staffing will not be a panacea to our capacity issues, but it will certainly put us in a much stronger position to be much more timely by way of annual reviews across the piece. It doesn't just relate to supported living, of course, because again, reviews is a much wider matter.
Okay, thank you. Anything else on that? Okay, so just to note that I think I hear exactly what you're saying. It's two separate things. However, that has an impact on, if one works, yeah, exactly, if one's working. And I think really it's just really helpful for the panel to understand about the reviews, what the pressures are. So if we could have some data on what the current, backlog pressures are on that, and then, the expectation around with the new staffing, what that drive is to reduce that, because that's what every resident asks us, isn't it, about their care review package, and make sure that that's at least on, that annual process actually happens. Okay, so we've got 5% staff saving, which is projected full year savings of 80,000.
Yeah, I mean, that was, that should really be included in the above. That was just a slight change in public health staffing. It's already been delivered due, because Will's had some changes in his areas. And one of his long-standing employees retired, actually. So we've been able to make a bit of a saving. So it's already delivered.
Fair enough. Okay, so so I'm going to move us on because obviously not obviously, but we're going into adult housing demand, which we're not looking at. So we're skipping over that bit, and we are looking at public health. So that's page 49, but mainly page 50, and then we're looking at the capital forecasts. So that's aids and adaptations, etc. under there, and then there's a revised General Fund Capital MTFS as at Q2. So I'm aware of time. Yeah. So it's just gone 9:15. So I'm just making sure that we're going to, be pithy. So as we always are. But yeah, so just to sort of move us on now into the public health realm. So that, as I said, is page 49 and going over into page 50. So I'm going to ask, are there any questions on the public health table? They're forecasting 100% delivery of their savings. Yep, Councillor Horan.
Yeah, my question is on the first one, 0 to 19 years public health nursing services efficiencies. Look, I'm sure all of us are cited on the current email today from Will about the increase in measles. And I don't think this is going, I think this is going to be something that will be more prevalent going forward in the coming years, sadly, because the uptake of vaccines have dropped, right? So my concern is this 0 to 19, is this nursing going to impact in any of this type of vaccine program or the delivery of vaccine to the community, please?
No, it wasn't. It's not a staffing saving or reduction. It was back office efficiencies that the public health team collaborated with the provider on. So there were some changes to the buildings that they were working in and other kind of back office efficiencies. So it's all done and delivered and doesn't impact on either the vaccination program, which is somewhat separate to this, or indeed the staffing levels within the 0 to 19 service. But the vaccine program's separate to this. But Lucy, you might want to come in as well, just to...
I think one of the most important things is that within the public health budget is we have some space for community champions who work with particular communities on exactly the kinds of issues you're raising around increasing vaccination rate and reducing what we can't call vaccine hesitancy. And that's something we've, I suppose, supercharged, if you like, in more recent times with specific representatives in probably our broadest key communities. You're right, we do need to see improvements in vaccine rates. Unfortunately, it's a London-wide and a bit of a national issue for all the reasons we've talked about before, I think, here. So I think that it's probably a bigger problem than us, but we can do as much as we can do, and we are, I suppose I want to reassure that we are investing part of the public health budget, especially on doing the targeted work, because otherwise all we see is people, the same old people, even refreshing their vaccines because they're very worried, but whole sets of our community who they're not getting the first one, or they're getting just the first one and not the second one. So there's quite a lot of targeted work that goes on, and the recent outbreaks probably suggests even more of that targeted work's needed.
No, that's an excellent question. I know Wilma Morris, Director of Public Health, just sent us all an email about the outbreak of measles, which is really concerning, isn't it? So, that's beginning to take hold, unfortunately. And, that we need to promote it amongst all our wider groups around the MMR. So, yes, but thank you for that. That was a good question. Any other questions on I hadn't got anything else on the rest of the public health. So there's deletion of public health business support or vacancy factor savings, I think. No, okay. So we'll move on to capital forecasts. So this is the spend. So we've got the scheme reference, aids, adaptations and assistive tech, homeowners. So there's the revised budget Q1 adjustments, increase in the budget. So an overspend on the Q2, my understanding is 11,000, is that correct? Variance, yep, okay. Councillor Mason, did you have any? Oh, sorry. Okay, all right. Okay, so I'm just checking if I had anything. I mean, I suppose the only thing is I've got RAG status on time is amber. So is there anything here that we need to be aware of in relation to that? It's absolutely fine. The RAG status on time I've got here is amber. So the scope and the budget are green, but the time is amber. So I'm just checking.
Yeah, just to say, yeah, the point of this report, that was Amber. We've been procuring new contractors. As you all know, Aids and Adaptations is, and always has been for many years, I hear, an area of high risk and high challenge, and lots of communication with residents who are incredibly stressful. We've gone out to procure new contractors to give us a bit more pace and to be more responsive as a service. And it's one of many improvements that we need to make in the space of aids and adaptation. So I think by Q3, we'll have caught up there. And we'll be in a better space. In fact, we've just signed off those contracts very recently, haven't we? Within the last week or so.
Thank you, Jane. Any other questions on that? No. Okay. So I've got the next one, which I know I've got a question coming up from Councillor Mason on community alarm.
Really quickly, this is another area that has historically been very challenging, and I just want to check that you've got expenditure is planned and in progress. So are we going to be able to deliver the service, and are there any hiccups with that?
I don't know what you're referring to there. Yeah, I believe this is the digital IT platform. That this is also just been signed off this week, hasn't it? It's been a good week for signing things off. Yes, all in hand. We had to procure a new IT platform for connected care, and that's only just been completed, yeah, this week. So all in hand as well.
It's worth saying that this is only part of a bigger budget, so this is just one capital item on what is combined with a revenue budget for the service. So just to make sure that members are aware that this is just the capital element of that. Thanks.
Thank you. So we've got Canning Crescent, assisted living. I think that's now, is that now open and up and running, or is that?
Thank you. Yes, Canning Crescent. Well, in fact, it started opening in the autumn, but we had the formal opening, and you'll all councils will get an email soon in your inbox about an opportunity to visit as well. But we had the formal opening yesterday. It is, of course, called the Roger Sylvester Centre at Canning Crescent, named after Roger Sylvester, and his family have walked alongside us on the project, which has been particularly special. And so last week we had a small event, largely with Roger's family and a few key staff, just to formally name the building. Very much a Haringey funded and Haringey Council project, but with our partners in the NHS and voluntary sector. It will enable us to have a combination of crisis beds and more crisis beds than we've had up until now, which is really positive, plus housing the Clarendon Recovery College, our safe haven run by Mind, but also it's really at the nexus of that neighbourhood health, mental health hub, if you like. So lots of potential for more, I think, as time goes on. So really positive, and it will stop being a budget line and become a real thing in the community.
Right, thank you. And just to ask, because obviously there's crisis beds in there. So I know there's an awful word to say about investor save in this area, but is there any, would you be getting any income generation from sort of, you know, like the ICP in any placements for funding of people that need support, or would we be getting any extra income in as a result of that?
So a couple of things. So there will be, it won't come to adult social care, but there will be income by way of rent. We will charge. So there will be a fee for both organisations that are part of that. So for corporate property, there will be an income associated in terms of the lease and rental arrangements. We will go from 7 beds currently, which is we've got a crisis prevent, or when I say we, North London Foundation Trust have 7 dedicated beds for Haringey residents in Fortis Green, which will transition to the new site. We're doing the we had the session last week and the open day, which we'll have later on in February, which you will all be invited to, before we transition those services over, so we can show everyone around what the facilities will be, because that will be people's home for a period of time. So we want to be really respectful there. So we're doing that in advance of that transition for that reason. So it'll go from 7 to 13 beds. Which will be it will be helpful by way of that, it's an admissions avoidance piece. So the aim is that allows people to be supported when they are struggling in the community and will avoid a need for an inpatient stay. At St Anne's, for example, people will voluntarily be able to come and go, but there will be lots of support wrapped around them. So really important for our residents, and we hope it will be a pathway flow into the recovery and the support around training and help and even work. We had a wonderful story from one of the members of Clarendon Recovery College, who actually went and is now a member of staff and actually was supported by the college. So hopefully you get to meet her when you come to visit. And then so in terms of will it offer a reduction, that probably is more that will offer a financial benefit because of the increase in beds in borough and therefore less need for out of borough placements, but that will be largely a benefit to the North London Foundation Trust, because obviously at that point they will be providing the care and support for the residents. But it's a much better outcome for our residents to keep them local, connected to their family, their friends, and their support networks. We hope, though, that would be cost avoidance to us, because therefore we hope that the people don't need to spend longer term in hospital, and therefore the community support and the care that they might need from social care when they are going back home or don't need that level of intensive support. The theory is that would be cost avoidance because that support need would be less. But it's not a direct kind of saving, it's more a cost avoidance, but really, really important for our residents that we will have that facility. And I've done quite a bit of research. I can't find a facility quite like it in the country. If anyone can correct me on that, but I have been doing quite a bit of research. I think it's quite it's so important, and we know mental health is such a priority for us. So really, really pleased to see that opening.
Thank you. We look forward to the invitation and to visit, because I think it's hugely important to have that support in our borough. Councillor Donovan.
I just want to very quickly pass on my thanks and congratulations to all of the councillors and officers over the years, long before my time, who've been working on this project and kept it going, and for the reasons that Sarah's outlined, the incredible well-being benefit of well-being to both the people who use it, but also their families as well, but also the financial benefits, the cost of avoidance in the future. And I think it's a brilliant example of spend to save. And yes, I hope you don't find anywhere else in the country, because we want to hang on to our uniqueness, and I think it is unique. And it was brilliant to see the photographs of Roger Sylvester's family with the council officers and councillors last week. Thanks.
Right, thank you. Moving on to locality hub. Okay, so we've got the Q2, so full year forecast. We've got the budget variance. Scheme is on hold pending review of business case. Is this because we haven't got somewhere to put the hub? Is this a spend on the actual place?
So this was for specifically for the NRC, the Neighbourhood Resource Centre that we've spoken about over the years. There is a proposal to remove this from what will be the general fund capital budget in next year's proposals, and that's because in essence, it's a HRA asset. So any capital spend for that scheme will come off of the general fund and will be under HRA. There was a bit of an anomaly just in some of the historical papers. So I don't want colleagues to think we're not necessarily, we're not saying that it is under review and going through a pause by way of a wider business case piece, but that's not to say that it's coming off when it's being removed, because it will be considered as a HRA budget spend, and there's a lot of activity to understand what the opportunities might be for that area across the housing team, as well as I'm going to get his title wrong. Head of Estate Renewal, David Sherrington is his title. He's doing some collaborative work with us. But yeah, that is just a preempt for what the budget proposals are there. That's for that reason.
Thank you. So I just would ask, because locality hub is very important for adult social care as well. So if we could have sight of that as it progresses, I completely understand if it does move to the HRA, it's very difficult to do that. But if we could just have like a little box and go, oh, by the way, it's really useful for us to understand. So the rest is housing. So obviously we're not going to be looking at that. And then we've just got the revised general fund capital MTFS. So that's, to be honest, I think that's the same. I can't see that there's nothing specific that we need to note on that. Okay. So that completes the paper on the finance report for Q2. So unless there's any further recommendations from the committee on that, I would just like to thank the finance team and the officers tonight for coming to speak to that. I know it is difficult. There's a lot of meetings going on and there's a lot of reports out at the moment. So, separating what you've got an update in the cabinet paper from this, I know has sometimes been a bit of a brain teaser, but it is really important. And thank you, because the other committees did look at Q2, so we did that. So we've got the recommendations from this evening. I just want to let officers say thank you very much, but I'm looking to my committee members, please don't run off, because you have got you've got the work programme to quickly, just very quickly look at, because there's some updates on that for you. But thank you very much, everyone. And it's not 10 o'clock, so, there's some positives to this. All fine, it's all fine. I know, I agree. Right, okay. Under the work programme, guys. So just to let you know, I know she is, I can see that focus from Helena. So we've got the discharge from hospital report. Now I know we've been doing this since 24/25 and there's been a tad of a delay. However, there has been all systems go recently. So we are absolutely trying to get this to OSC and therefore Cabinet before June, because otherwise it doesn't, it'll be a different group. So everybody is trying very hard at the moment. I think the report is written pretty much. And so we are looking to try and get this, but we just need to go through legal and finance to make sure they're happy with the report. If they're happy, then you will be sent a draft, but it will then literally be going straight to OSC to recommend it, and then straight to Cabinet, so we can get it through our. So thank you very much. That was just give you an update. The other one was around, which I've already spoken about tonight, the Joint Adults and Children Scrutiny Committee meetings. We're just looking for a date for that. because I know, this is quite an important one. We do it every year, and there's usually a huge amount to talk about in the area of transitions. So I just wanted to flag that up with you. Just finally, I know we mentioned it at the start, but on the tracker, we will be getting an update as soon as. How long do you think it might take to get some responses?
I did ask for timescale, but I didn't actually get anything definitive back. I mean, basically, they only received the action points a week or two ago because of that's when the minutes were completed. But we should have something over the next couple of weeks, and I'll send that round by email. And if anybody's got any questions, even though we don't have another meeting in this cycle, you can still raise any questions or recommendations, and we can put those forward.
And I just wanted to say, obviously, we wanted to clear the tracker to make sure that everything is responses and that we agree with them, so that, if there are any concerns, please do, because we do need to sort of finish this tracker. So for the next Adults and Health Scrutiny Committee in June, or whenever they have their first meeting, this will be a nice green, it'll all be completed and they'll know exactly where they are. We won't look to put in any, we've got items on the agenda for the next municipal year. So it'll be up to that new committee to decide, obviously, what they want to scrutinise. But we are in the process of finishing our communications, which joint partnership board, and therefore the item of urgent business today. But we are looking to complete our communications project. Dominic, how far are we along on that?
Yeah, I'm still trying to get a date on basically what will probably be our final session, which is on the digital aspects of it. So speaking to someone from the digital team, along with Joe and Sarah, we basically need to get everything sort of wrapped up by end of February. So yeah, we'll keep an eye out for an email about that, which will give you some details about when that's going to be. And then, yeah, that has to go to OSC on the 11th of March. So yeah, that's the plan for that one.
Okay. So that on the 11th of March, that will then take the report to June, won't it? So that one we won't be, they will finish it, it won't be presented by us. It was just that's the thing. So that's it. And I just wanted to say thank you. So I've greatly appreciated all your support and hard work, and really hard work, because I know this committee does go on, it does use every ounce of the minutes in the day, doesn't it, in scrutinising. So it's been an absolute privilege to chair it, and I just want to say thank you very much. So thank you.
I think we could also thank you.
Going to be here, so he's not going anywhere. So just to clarify that.
Well, it looks as though we're going to have one last meeting maybe with the digital, but I think yes, as Mary and yes.
That was my last Adults and Health Scrutiny meeting, and then we've got hopefully the joint. I've got OSC and JOS still to go, but this is the last Adults and Health. So I just want to say thank you very much. It's been a pleasure. Thank you. Yeah.